Dr. Rajeshwari has been our faculty for a long time for advanced training for wound management and understanding how you can do limb saving by ozone bagging and other applications of Ayurveda. So over to Dr. Rajeshwari, she's going to talk about integration of ozone in Ayurveda. Slide change.
Welcome everyone. Thank you Dr. Neeli for such a wonderful introduction.
It was a short one. I would have said a lot more. But
In today's world, we all know lifestyle disorder is rapidly increasing due to contamination of food, water, air, pesticide in food and GMO food. And in post-COVID era, we all know rapid rising of avascular necrosis, acute pancreatitis, diabetes, and other pathologies. So they need integration to address this complex pathology. And over the 13 years of my experience, I encountered some hurdles and complications while application of ozone. So I have explored this subject and I want to share same with you, my experience. And we all believe that integration is the future of the healthcare system which can address complex pathology. So let us deep dive in the subject. Why integration? For better outcome, shorten length of recovery, cost-effective tools, and uneventful procedure, and to address complex pathology. So disease which can be treated with rectal insufflation. This is systemic approach. We won't go in deep, just coverage of the subject. This is local approach. Is it okay?
Previous one. Previous one.
Previous one.
No, previous.
This is systemic approach. This is local approach. Yes. Now this is integrative approach. Rectal insufflation. How we can combine with other modalities. So I am treating the patient of autism, multiple disabled children, global delay, even Down syndrome, genetic disorder. So in autism and all this address for convulsion, for dystonia, hypertonia, hypotonia. So we need to give some herbal ghee preparation or oil preparation. But Bachu is too small to have all these large doses. So what I do, first I give rectal according to patient's condition, and then in same tube I insufflate, insufflate 10 ml, 15 ml of medicated oil or ghee to address all this issue, and I am getting very good result because our oil and ghee is not very tasty, and patient can't indulge it. So in autism I integrated with the oil and ghee preparation. Then piles and fissure. We all know piles and fissure is a very tender and very painful. As soon as touch with your, I am always using infant feeding tube, 8, 9 and 10, and 8 and 10 number. So as soon as you touch the rectum, that tender area, it is very painful. So before that I push some ghee, Jatyadi growth, Satyot growth, or some oil which gives cooling effect. And then I introduce ozone. And after ozone, I push 10 ml ghee in withdrawal manner. So all tracks are lubricating. So it gives very good result and procedure become very smooth. Medicated ghee, Jatyadi Growth, Mahatikta Growth, Chandanmala Lakshadi Tel, Dashmul Tel, according to patient conditions. In chronic constipation, so we all know ozone is a drying agent, and we all are seeing lot of diabetes patient, and because of neuropathy they have a constipation. So what we can do? As soon as we give rectal insufflation, then constipation will increase, and patient is loaded with gaseous distension and indigestion. So in that condition, I give Kadabasti, Nirubasti, which the small erandmul, Tifla, and with some medicated oil and ghee. And next day, I give rectal insufflation. So it really gives good result, and result in 3-4 also. So this is the integration with Basti.
Can you please repeat, ma'am?
Ma'am, when you said
Last
that, when you gave the Neeru Basti, whatever you
Neeru
give it,
Basti, Neeru Basti is another name is Kada Basti. It's a Panchkarma procedure. If patient is ended with constipation, first 3 days you give Neeru Basti, Dashmul, Erandmul Bharal, Trifla Bharal with some oil, eel oil, Dashmul oil, Erand tail, Singhav and honey. So there are fixed protocols. And 700 to 800 ml at least. And first day you give Neeru Basti, Kada Basti, and gut is clean. Then next day you introduce ozone. If constipation is severe, you give first 3 days Kada Basti with oil, and then 4th day ozone. So it gives 3-4 result, and it's very good for neuropathy. Because in diabetes patient, constipation is due to neuropathy, not due to any gut problem. So it is very good. Even I am giving Matra Basti also, oil Basti. So I can also sandwich it. First day Matra Basti, next day rectal. Again Matra Basti, again rectal. So it also gives good result. This is breathing ozone through oil. We all know the indication of the Boto. So now integration of Boto. How can we do integration of Boto? So first I give steam. So which reduce the inflammation, soothe the breathing, and lose the toxin also, lose the mucus also. Then I give breathing ozone through oil. After breathing ozone through oil, I always give Nasya. Nasya according to patient's condition. I am big fan of Suthi Nasya. In sinusitis, bronchial asthma, chronic cold and cough, I first detox with Suthi Nasya, and once the patient becomes sterile and there is no cough at all, then I advise him to take Anutel Nasya, Panchindriya Vardhan Nasya, or any Bruhan Nasya, Panchagavya Grut Nasya, Gogrut Nasya, according to patient's condition. But it also gives 3-4 result if we combine with breathing ozone through oil and steam. This is the integration. It is very interesting subject. Disease which can be treated by hair bagging. We all know hair fall, dandruff, seborrheic dermatitis, scalp psoriasis, fungal infection of scalp. But how to approach? Wet the hair, bagging, scalp injections. Here is a wrongly said after scalp injection I give rectal, then hair massage with herbal oil, and I always put vitamin E capsule in each and every application. So it gives very good result. Then steam. So how it works? Wet the hair first, wet the hair first, then ozone bedding, put the tube from back side, ozone injections in scalp area, dosage is 5 to 10 microgram per ml with 30 number needle. I always use 30 number needle for scalp injection. Then rectal. So you give a gap for hair massage and scalp injection 15 minutes. In 15 minutes you give rectal. After rectal, the patient went to washroom and then you massage, gently massage and then steam. So I will tell you it gives almost 90 to 95% result. Very good result. And I am saying out of box. Once you done with the consultation, you can switch over this case to your assistant, and in your absence, you can earn money.
Only scalp should be made wet or the entire hair should be wet?
Entire scalp only.
Only scalp.
Only scalp. Because we are giving on scalp, right? Or ozone is act on aqueous medium. So we are giving only on scalp.
How frequent is the week?
Huh? 5 to 10 microgram.
But injection is usually local and
No need. You give fast injections. Within 4 minutes you cover 20 to 30 pricks. It is so fast. And 5 to 10 microgram per ml.
how many sittings?
How frequent?
Twice in a week. Twice or thrice in a week.
Ma'am, which hair oil to be used for hair massage?
Hair massage according to patient's condition. Suppose patient has fungal infection, then our ozone revive is very good with coconut oil. If there is a dandruff, the Dhatur Patradi Gunja Patradi Tel. If psoriasis, then 777 oil gives good result. And add vitamin E capsule in each and every application, gentle massage and then steam. Just you try it, it gives 100% result.
But how much you charge per session?
Oh, ये अंदर की बात है.
How much you charge?
Dhatur Patradi, Sorental, 777. There are very good market preparation. Even our ozone oil, hair revive. So yes, 777 gives very good result. People may correct me if anything wrong.
It's from Dr. JRK's company. 777.
Now disease which can be treated with by ozone bath. We all know. How we can integrate Abhyang? In Ayurveda it is called Abhyang massage. Abhyangam acharet nityam sramma vata jarapaha. So it is a relaxation. It is anti-aging. So in short, it gives like synergistic effect with ozone bath, and you give again good result in short period.
But bath should be after the shower because the oil.
No. First you give oil massage, then steam bath, then ozone. First massage.
Plain steam, not ozone.
First massage, then plain steam in same chamber. You start ozone. It is very simple. So first you loosen the toxin, and then
Ozone will
you
penetrate despite the oil film on the.
yes, steam. We are giving steam. So pore is open, then we can introduce ozone and gives really good result in very few sessions. And it is good for calorie loss also. No? For obesity, it is very good.
If you are giving
And
hair sauna,
huh?
if we are giving hair sauna, then
hair sauna.
infrared sauna.
Infrared, no, I have not tried.
Should not give on the day of sleep.
No, I am not using steam sauna. Infrared I am not using. I am using only ozone bath. Steam.
Ozone steam bath.
Steam bath.
Infrared, you can't do massage and go to infrared.
Disease which can be treated by micro injection on face. So for rejuvenation, tone of facial muscles, reduce wrinkles, melasma, hyperpigmentation, acne. How we integrate it? The same. 30. First step, give injection, micro injection over the face with 30 gauge needle, 5 to 10 microgram dose. Vacuum massage with herbal oil, growth or skin blossom. If I use skin blossom immediately I do after subcute injection over face. But I want to use some herbal oil or growth. So I give 15 minutes gap after injection, then I apply. Vacuum massage with herbal oil, growth and skin blossom. And customized face pack. Customized face pack according to patient's condition, patient's disease, patient's pathology. So I got very good result in wrinkle, melasma and acne. And always rectal insufflation as a systemic approach. Now disease which can be treated with ear insufflation. So these are the indications. So while giving ozone, so ozone again is drying agent. So it gives dryness in the ear. So patient gets itching. So what is the solution? After ozone, Karnapuran. So oil application in the ear. So it is a solution. Patient is previous. Now this is my favorite subject. I cannot complete my presentation without tissue healing. So these are the indication of tissue healing: diabetic non-healing ulcer, varicose vein ulcer, bed sore, crush injury, trauma, for faster healing of wound. Avoid amputation in plastic surgery in selected cases. And overall, to prepare healthy wound bed for plastic surgery, skin grafting. Integration of tissue healing. So I am presenting one case. Can you? Next, I am coming back. Can you appreciate this image? What type of wound? No. Diabetic ulcer. Yes, this patient is a came with diabetic ulcer, not at this stage. I am sure telling some stories. He is a 58 years old male patient, and with ulcer, they have some family function in their family, so he ignored wound for 25 days, and this is the result. She landed with this condition. You can see non-viable tissue, gangrene of great toe and first finger, lot of infection in just 25 days. They have not done even tracing also, Bayesian function. So these are the condition of the wound. So at this stage, he came to me. I said that this is not my cup of tea. So you have to have partial amputation and debridement, then you can come to me. So they went to Susruta hospital, and they told you have to amputate 3 fingers and red toe and first finger is always there, he gave it, and another 3 finger. But patient refused it, and this is the first cut of the amputation. So you have to come for second time for second amputation. I am sharing his MRI report. Now we will. So what I have done, surgical debridement and partial amputation by surgeon, because this is not my subject. I know my limitations. Antibiotics according to culture sensitivity. When he came back to me, so he had given third generation of cephalosporin, but lot of infection, foul smelling. Even I had first therapy. I could not eat for 3 hours after this therapy. It is so foul smelling. So again I sent culture and sensitivity, and after 10 vectors again culture and sensitivity, it shows a sensitive to tetracycline, which is very basic antibiotic, and I switch over to tetracycline. In ozone, either ozone bagging, rectal insufflation, ozone injection around the wound, and weekly high IV vitamin C 15 grams. Ayurved medicine I have given Sariva Manjistavati, Raktapachak, Arogyavardhini, Shatadosrut, in appointment, stages 5, and diet. Huh? Vitamin C 1.5, antioxidant 1.5. Yes. ELOC is a nanoparticle of curcumin and zinc. It is a very good preparation of Pentacare laboratory. Food dressing. My stage is 5. First I used Vectigras, then every day. I not write down each and everything, but stage is 5. If there is a slough, then I use every day. If there is a dryness, Satagotli. If I want to give some moisturizer, then Vectigras and antibiotics. Like and diet based on Ayurvedic principle. So it is a classical example of integration. So we can see the results now. So when he came after the amputation, so this was the condition. So there is minimum blood supply. From hospital after amputation, immediate photograph after amputation. This is at my clinic after 5 to 7 sessions. This is latest image of the patient. Just I took on Wednesday, on 5th of February. So you can see the wound condition before ozone treatment and after treatment. So it is a healthy wound bed. You can see the blood tinge also, healthy granulation also. So I advise him to take go for skin grafting, but patients are refusing. So how it goes, I don't know, but still I am continuing the treatment. So this is his report. So generalized atheromatous and calcification changes, no evidence of any significant stenosis or occlusion above popliteal artery. Chronic occlusion of mid-distal posterior tibial artery, multi-segmental stenosis in proximal mid-anterior tibial artery. So severe calcified vessels. So his surgeon advised to amputation at the angle of ankle joint. But huh? There is high chance at the at least level of ankle joint. So it is because of not only ozone, not only surgical intervention, not only Ayurveda, but integration with ozone, Ayurveda, IV nutritional. So it would be possible, and we can save the limbs. No, I am not doing chelations. I am doing with Ayurveda, IV nutritional, ozone, and modern approach. That's it. So one of the, this is a before treatment photograph and this is a latest photograph. You can see the difference. So it is a classical example of integration, and if at this stage we can do skin grafting, then 80 to 90% result of skin grafting. That is the measure of ozone. So believe me, I have done debridement at OPD level with minimum instrument 7 to 8 times to reach to up to this level for a healthy wound bed. Now, one of the angle is a diet angle. I always prescribe diet with my consultation, and it is mandatory and it is always customized. Be it patient of autism, multiple disabilities, wound healing, diabetes, hypertension, there are specific diet for specific patients. So, what is inflammation? Acute and chronic. We are not talking about acute inflammation, but chronic infection, chronic inflammation. So, what are the causes? Obesity, frequent smoking, stressful life, more consumption of saturated fat and trans fat, processed food, and disturbed sleep. What happens with inflammation? We all know type 1 diabetes, rheumatoid arthritis, psoriasis, multiple sclerosis, all autoimmune conditions. So it is a very vast subject, but I choose the golden rules to share with you. So drink water when you feel thirsty. No WhatsApp University. Take 3 to 4 liter waters per day. Eat according to your hunger. Consume locally available fruit, vegetables and grains. Follow the rules that your ancestors do. Okay. So locally available food, grain and fruit we should use. Avoid use of EV, mobile while eating food. We actually don't know what is the taste of our food. We are seeing TV and serials and all that thing, and how much quantity we are eating, that also we don't realize. So it is one of the cause of inflammation and obesity. So avoid use of TV, mobile and gadgets. So diet is always, it should be patient friendly. Imagine yourself in patient place and then prescribe the diet. It is very difficult to follow each and every rules and regulations. So it is always patient friendly. It should be very tasty. So it is like that. Thank you. Thank you for participating.
Board certified physician. For me, one-stop solution for hormone, for any difficult cases. If you need her opinion, she'll go in the depth and address it. She also teaches bioidentical hormones and how to make or how to treat metabolic disorders from the core. So over to you, Dr. Sudha, and her topic is anti-inflammatory markers for autoimmune diseases and beyond. Thank you, Dr. Sudha.
Hello. Thank you so much. Everybody is ozonated and done, ready? Yes. Yes? So you need more oxygen here and more, because everybody is ozonated from morning. So we are diverting a little bit here. I think most of the people, most of everybody knows me. It's not ozone anymore, it's inflammation. Can we dig into more inflammation now? Yes. Yes? If everybody you think can get some tea, coffee, it's going to be a in-depth kind of information, and only to think and thought process. It's not a protocol. Let me again warn you, my lectures are not a protocol oriented. It is just to wake us up in this medical field, what we might be missing and what we might be do more into integration. So this is more what we are missing. So you'll get lot of information here, and can feel free to buzz me anytime in the next couple of days. So we are doing ozone, we are doing a lot of inflammation. So at the same time, practicing physicians, healthcare professionals, we all know we come across autoimmune disorders. Is that correct? But again, we are lost and we are stuck somewhere with the so-called autoimmune disorders. We are not progressing anywhere into a positive way. In an allopathy, homeopathy, Ayurveda, we all need to come together for this one condition. Do you all agree? Yes. Yes. So, we are not having any extraordinary results when we choose any one field of medicine. So, if this is one field of one problem, disorder, disease, that we have to have an integration. And if we don't have an integrative thought process, we will still be lost. I am a hardcore allopathic physician, but I embraced the other all naturopathy, in any way, homeopathy, and so the team is the key in terms of integration. So I might not know everything, but we have a team that we all work together under one umbrella. So this is going as the first slide says, we have to do integration on that. So the latest study paper I am sharing with you of 2022, that in autoimmune disorders, what else we were missing and what is the thought process that we need to go into a different thought process. The interplay between an autoimmune disorder as well as an autonomic nervous system. So did we overlook this subject in all kind of an understanding is the key. So autonomic nervous system, inflammation and cross interplay between these behind the causes for autoimmune disorders. This is where the modern science, integrative medicine or a functional medicine or whatever you want to call, is thinking in a depth and a root cause levels for autoimmune problems. So I want to go a depth of interplay between autoimmune disease and an autonomic nervous system. So we all know everything, this is what we've been talking and we will be talking for the 3 full days. If anywhere across, these are the 3 circles that you will come across about excessive reactive oxygen species generation, which gives you oxidative stress, immune aging, which is dysfunctional of other parameters into DNA damage to repair machinery, as well as psychological stress. When we say psychological stress, it doesn't mean it is the simple psychiatric conditions, it doesn't mean it's only depression and anxiety. There is a whole new depth of knowledge in the psychological stress which do play a role in autoimmune disorders as well as autonomic nervous system. So a lot of research is going on. So that's why I thought we will, there's a good platform, openness and open-mindedness there. Maybe a little bit add on to the spice to all the lectures that we go through. So we all know the missing link. This is in depth. We have to do this. We have to take enough time to understand these things. If we don't take enough time in our consultations and we're still doing as integrative physicians with ozone and everything, and if we don't take time, 15-20 minutes for each patient, we will still end up missing the diagnosis link between them. So more than volume, if we cut down our volume and do more integrative approach with focused care, you will get more satisfied as healthcare professionals as well as the patients, the word will spread around. So this is all the immune upregulation. So when you say autoimmune disorders, it's all about immune upregulation in terms of combinations of toxins. It could be because of the toxins, it could be because of the nutrient deficiency, the leaky gut or chronic infections, food sensitivities and adrenal fatigue. This was an understanding until 2020. Post-COVID, post-information that we have, post-COVID, the kind of psychological stress we all went through, there were different data, there were different kind of understanding that they added mental as well as emotional being as well. How can you identify an underlying predisposing factors for developing autoimmunity? So I right now for the past 5 years, I am focusing primary on this and then switching back. 5 years ago, I was also, focusing there, but there was still a missing link. So again, it was reversed, going back to childhood disorders, childhood traumas, childhood psychiatric issues, always has to come in your history and physical. Now why and where is this missing link? As an autoimmune, this is autonomic nervous system. So we all know autonomic nervous system has sympathetic and a parasympathetic. So there is so much of correlation between these two that we have to pay attention of sympathetic nervous system and a parasympathetic nervous system. The people who are researching, you must have researched a lot about vagus nerve nowadays. There's a lot of research going on functioning of vagus nerve and therapies and all that. That's nothing but understanding of autonomic nervous system, and the reason behind that the missing link is there. That's what vagal therapies are coming up. Now I'm going to talk about that as a theoretical part and a scientific part where we go through where we go. Another thing of an autonomic nervous system is the nervous system as the hormonal system. So we all know the hormonal system plays a huge role in terms of autoimmune disorders, the thyroid, the adrenal, the diabetes, we know that. But what is the nervous system? So the nervous system is nothing but the autonomic nervous system, which is already integrating with the hormonal system. Maybe that's what we need to think. Now what is the nervous system that we have we need to play in picture? The nervous system is the central nervous system, which is the brain and the spinal cord, and the peripheral nervous system is a sensory and a motor. It's in the name, it is sensory, and one is motor. If we didn't understand or integrated so much into the integration, then we are not going anywhere. So the sensory system and the motor system, the somatic as well as an autonomic nervous system, which is sympathetic and a parasympathetic, needs to be integrated in terms of future of medicine. So what is this somatic and autonomic and sympathetic and a parasympathetic? What are they doing other than nervous system as well as nervous supply? But what is the emotional as well as the psychological as well as the hormonal, release that they have? Are these integrating together? So we all know this is the hormonal system, the hypothalamus, pituitary, thyroid, parathyroid, adrenal, pancreas. This is where the autoimmune disorders come in place, including diabetes is an autoimmune disorder, thyroid is an autoimmune disorder, most of the skin conditions are autoimmune disorders. So, and we are only with integrative approach, we are getting 50 to 80% of the treatment, but we are still, that 20% is still missing. So we have to be familiar with this, what we are doing, and why we need to be familiar with this is because sympathetic nervous system and a parasympathetic nervous system do play a role in our immune function. What do they play the role in our immune function? The innate immunity and adaptive immunity. The innate immunity and the adaptive immunity is the immunological process through an exposure that we have come across. The exposure could be an infection, the exposure could be a trauma, the exposure could be a food sensitivity, the exposure could be a parasite, fungus, the exposure could be anything and anywhere, as much as during pregnancy also, during the epidemiological conditions. So what is an exposure while it's in the fetus, period? What kind of an emotional journey the mom is going through, and what kind of a microbiome that has been exposed to. So they do play a role in terms of innate and adaptive immunity, and that's where they play a role of sympathetic and nervous system. So that's why we have this, and how the innate immunity, when it is, we have a cytokine secretions, we have neutrophil decrease and chemocytes and phagocytosis. Is everything behind this simple slide where autoimmune disorders have to be addressed in terms of this thing. So whenever patients are coming to you, just keep it in mind, sympathetic and parasympathetic. If you go back to this slide, it's very easy. If you do sympathetic and parasympathetic, these are the organs that they supply to, and these are the organs which they supply to. So this is very, very key of keeping in mind about where and how and why things are happening. So this is a very heavy text slide, but a very important autoimmune nervous system and sympathetic nervous system. Autoimmune nervous system controls our heart and other organs of the body. Now sympathetic nervous system has left sympathetic nervous system and the right sympathetic nervous system, and these two are different. This I understood less than 5 years ago, that these two, it structurally might be same, but psychosomatically they are different. So the left sympathetic nervous system has a different role, and the right sympathetic nervous system do have a different role and play of mechanism of action. So besides these nervous system, body consists of different organs which will perform various functions, and gross physical body subtle systems which purifies the energy flows through the organs and the nervous system. Chest and energy kind of medicine is just coming into limelight. How do we can do prove it to as a modern science? Before it was like, okay, it was an understanding, it was a patient to patient, it was one, but lately we are having more data, and we are having more, might not be double-blind control studies, but we are, everybody is accepting yoga as a universal exercise right now, and everybody is accepting meditation as a universal relaxation. Why? Because it has proven beyond expectations. And how did it prove beyond expectations? Through the systems of sympathetic and a parasympathetic nervous system. So it's proven that these which this country has been practicing for ages, and now the modern medicine has been accepting. So this subtle system is explaining Yoga Shastras in the form of chakras as energy centers and nadis as energy channels. I have foolproof data how the nadis and chakras are interrelated to systemic, sympathetic and a parasympathetic nervous system. I was shocked to come across such kind of an integrated, that how did we miss for the modern medicine of 50 or 60, 100 years old, we just totally missed, and we got diverted into structural thing, but these are electrons and photons, these are not structural kind of a thing. But today the world is accepting, and the modern medicine is accepting. That's why the sympathetic nervous system and a parasympathetic nervous system is linked to our scientific olden science of chakras and nadis, and then that's what I just want to keep a liner there. So that's why, because that's the, again, sympathetic division, and this is a parasympathetic division. So the sympathetic divisions have those nerve play, and the parasympathetic division as well. That's the reason diabetes, when you're doing it, you have to go to the parasympathetic and a sympathetic pathways when you're doing the same organs. Sometimes different organs and different glands are secreted, and this picture comes in place. Now just a one-liner about that. Now did we miss this parasympathetic and a sympathetic, where one kind of a yoga practitioners are saying the Pingala Nadi and other nadis. So these are sympathetic and a parasympathetic, which is left-sided sympathetic and right-sided, and nothing but the spinal cord and the parasympathetic nervous system is this. Did we miss something as physicians? Did not pay attention to that. Again, this is one slide out from 2022, that how they are integrating these three things together. The T1, T2, T3, T4, the chakras which are angled, and the plexus. You must have heard about the plexus, the cervical plexus, the lumbar plexus, and the different kinds of plexus. So it's a thought process. Are the plexus related to the chakras? So because the position is the same. So did we miss this? Okay, we named as plexus, and then the olden science said is as chakras. So this kind of an interlink was missing, and the data has shown that these are, when you approach things in this pathway, autoimmune disorders do have a different kind of a result with the integrated approach that we are taking. So after the sympathetic chain, the parasympathetic chain, how they are interlinked through the plexus and through the organs and to the parasympathetic. So this is one slide where we have to come in place. The same thing as pulmonary plexus, the sympathetic plexus and the cardiac plexus. So when we looked at the cardiac plexus, it is It is coming close to the chakra that is always they've been told. And then when you come into the pelvic plexus and the coccygeal plexus, the position is the same. So why don't we think of it when we are talking about plexus and this chakra? The position is exactly almost the same physically when we are looking into the nervous connections. So when we took this and we said, okay, then there is a different kinds of an approach into this because they are interlinked to the organ. This is what in US, in my clinic, they are talking about this, and I am sitting there, right there, from one only physician from India, and all the physicians are from all over, and I'm like, what's going on there? Because this is what I heard, but I never believed. Okay, I never believed, and I said that's not what it is, and I'm the only one sitting there, and they are talking about this. It was goosebumps coming, and I almost had tears that day, and I'm like, I had to come there and learn something and come back and said, you know what, we were always right. So I felt proud at the same time. So again, coming back to the modern way about autoimmune disorders. So to know the inflammatory processes in an autoimmune diseases are mediated by hypersensitivity reactions. This is what the textbooks have, the modern medicines have taught us. There is some kind of an hypersensitivity reaction. In that hypersensitivity, there is type 1, type 2, type 3 and type 4. So, disease-causing tissue damage due to type 2 and type 3 and type 4 hypersensitivity reactions do end up in autoimmune disorders. But the type 1 is an acute allergic reaction, and when you don't pay attention and when you don't correct the pathways, and the type 2, type 3, 4 hypersensitive reactions end up in autoimmune disorders. Now the stages of autoimmunity. So when do we, stage 1, stage 2 and stage 3, when are these alarming conditions? So stage 1, a silent autoimmunity, which you will see elevated antibodies but no symptoms of loss of function. So that's why in my patients I check everybody's autoantibodies. Doesn't matter, they don't have to be symptomatic. If you are an integrative physician and if you practice some kind of integration or functional or whatever you want to call yourself, please check your markers if the patients can afford. Yes, they are expensive, but not more than 13,000 rupees that you can get these kind of tests done. And when somebody walks into our clinics, we do these kind of testing. We check ANA, we check anti-TPO antibodies. They don't have to have a history. I do check everything of an autoimmune, and I don't blame just because their ANA is positive. I don't label them as this thing. It is a precautionary marker. So I do tell them it is a stage 1, it is silent, but we need to work on it. So the TSH, T3, T4 is absolutely normal, but my anti-TPO antibodies are positive. I keep them in track. I inform them, you have a problem of possibility of getting a thyroid problem. So be cautious. You are not thyroid right now, you don't have thyroid problems right now, you're not listening, but 5 years down the line, there is a possibility because your TPO is positive, because your AMA is positive, always caution them. This is what preventive medicine is about. It's not about treatment all the time. It's about treatment at the early stages also is you can do wonders. So that's why we do all kind of basic, whatever is available. You can check all kind of antibodies that you have so that you take care of that from here. And then stage 2, they are just elevated antibodies with mild symptoms and loss of function, no severe destruction of the tissues of the disease, but they're elevated antibodies, again TPO. All my TPO antibodies 10, 20, I still give them caution. 30, less than 100, don't worry about it, but look into the gut microbiome, take a little bit more history so that you can prevent. And I check every year and they trickle down and they become normal too. So you prevented a thyroid condition, you have prevented a connective tissue disorder, you have prevented a lot of stuff by giving them education, awareness, and then you don't have to do it for everybody, but today's Google world and AI world, they know everything in your ChatGPT. Okay, before you thought of it, now they know everything and they come up. Do your testing. but they don't know what is the solution, because at the end, ChatGPT in the medical world still say go to see your physician, right? So our jobs are still intact. So they still see
I
us.
can't take our intelligence away.
Yes, obviously. So we have a AI robot in our this thing. I love it. It does all my job very easily, and so that I can do my intelligent impact, and I can use my brains more. So that because it's my assistant. We have a junior Dr. Sudhas as an assistant. I really have one robot which just talks and all that. I said that's the Dr. Sudha of a bot, and we did it. The Leroy of that, and you know how it goes with this. So anyway, these are the Inhumans in one slide. These are all the autoimmune disorders that you can think of, and a self-antigen to, and an immune response to. So what is the disorder? Which organ is self-antigen to, as well as what are the autoimmune antibody responses. So as simple as post-streptococcal glomerulonephritis. It is an autoimmune disorder. The nephrologist keeps on biting about, but they don't know what to do, because this post-streptococcal is an infection which attacks the kidneys, and we tend to be against the kidneys, and we will have antigen antibody complexes. So this is what you have to think if they are giving a label. Before giving a label, understand which organ it is against of. As simple as multiple sclerosis. Ankylosing spondylitis and similar multiple sclerosis. It's brain and white matter. If it's multiple sclerosis, just think about the nerve. It's the brain. It is the nervous system. The nervous system has myelin sheath, and the myelin sheath is damaged. It is not any more difficult. So if you think of one-liner, it is not a tough thing. It is a difficult thing, but it's not impossible. And that's where you will see your autoantibodies too. And what do? It is integrative approach, including SLE, including myasthenia gravis, everything. Now spectrum of organ specific, non-organ specific. So this is one more. You want an autoimmune depth, then you will get a very full autoimmune. So they are organ specific. These are not organ specific, which is scleroderma and SLE, discoid lupus erythematosus, and mixed connective tissue disorders. These are non-organ specific, and there are organ specific. So again, examples, system-wise, blood vessels, multiple organ, endocrine, diabetes itself is autoimmune disorder. So type 1 is more than genetic, it is epigenetic disease. So type 1 also has been exposed to some kind of an infection as something which has damaged the beta cells in the womb. Could be not genetic completely, but it kind of an epigenetic volume which can be exposed to something in the womb. And Hashimoto's, anyway you do it, autoimmune thrombocytopenia, and the GBS that we said that somebody is exposed to in Pune, we had so many problems of GBS. There's so much going on in the viral, but it is some kind of a triggering factor. It could be the type 1 sensitive, that it must have, have an infective cause or a toxin cause, but nobody wants to look at it. When you say GBS, they're going to genetic. How can I be a genetic factor on one rush of 100 people in one city? So it is an outbreak, it is an epidemic, or it is an outbreak of something which is representative of a neuritis or anything like that. So it's simple. Let's say you don't want to test anything else. Let's say you don't have, the patient can't afford, and the patient can't go through into detail. You can just say ESR and CRP. CRP is an acute reactive protein, but for some people it's not coming down. After the infection, it's just not coming down. But the ESR, I do ESR for everybody, including RF factor or INET. When somebody's ESR is high, it is a chronic inflammation. It cannot be an acute inflammation. The complement secret, everything, you don't have to do the detail, but you just can start with a ANA, CRP as well as ESR. If these three molecules you want to do it as a precautionary, then if you can afford it, then go for a full panel of other parameters. So these are the in-depth markers for every disease. Again, you can't conclude, you really need to have a depth understanding about it. Again, if your ANA profile is there, then what do you do? If you have a vasculitis, then what do you do? So start with ANA. If it's negative, don't even get anywhere. Just don't even go anywhere. Again, anti-inflammatory myopathies, there are so many, it becomes more complicated, but that's why I do ANA and RA and leave it, because vasculitis, many people know that with vasculitis you can go for IV vitamin C, or you can go for ozone, or you can go directly, you don't need a conclusion about that. So this is more into what, if it is, what could be the clinical association with it. Randomly something has come, the patient is not symptomatic actually, so randomly what do you think? But you just give them a caution, let's not label them. Because we come back with this many charts, I have autoimmune this, I have scleroderma, I have this. I don't listen to the labels, I listen to the symptoms. I said, I will look at the chapter, I look at your file separately. Can you tell me your symptoms? Please tell me your symptoms. Because you tend to, as an integrative physicians, we tend to, because, our psychology, some doctor has been diagnosed, maybe that. So I don't look at the file right away. I go back to the patients, again symptoms. When did it start? How did it start? Can you give me a little bit more history? 2 years, 5 years, 10 years, that's okay. Tell me how did it start? Because you have to go back and front in question and answering. Let us also not label them for the same diagnosis that they got. Then how are we different? How can we be different? How are the patients going to have confidence in us compared to the already the doctors that they are seeing? When we ask them the right questions, when we ask them when we listen, because we take time and we want to know how it is. So that's exactly. So why do what we do? Because that simple anti-TPO or antibodies do have a different kind of implications. It is not only thyroid. It can affect the liver by increasing the hepatic glucose output. It can decrease the peripheral glucose use. So the same patient can come back with HbA1c of 5.5, 5 or 6, right? So you need to think that TPO antibodies are positive, TSH is normal, free T3 normal. Are these TPOs playing a role on the diabetes, on the pancreas? Right? So this is integration, because that's why you need to do the antibodies to think that. So let's not go by the diabetes, but let's look at the inflammatory marker of an anti-TPO. Now why is that elevated? Because we are not focused on the diabetes too much, but let's focus on the autoantibodies. So again pancreas, again in the kidneys like this. So again diabetic and thyroid storm. So sometimes people come back with thyroid storm with diabetes. They are not diabetic at all, but they come back with that. So these all autoimmunities are interlinked somewhere with everything, because it is self, it's against the self antigen. So when we are looking at that, we have to look at everything integrated. Micronutrient deficiency, intestine, microbiodata, celiac disease, probiotics, regulation of the immune system. Why do we put the vitamin D there? I'm sure with all the for back and forth information, vitamin D is not a vitamin anymore. It is an immunomodulator. That's why the immune dysfunction. People come back with 200. Maybe that's kind of an immunomodulator that the body is reacting to. It doesn't mean that they are overdosed. So yesterday only in the newspaper, the patient died with hypervitaminosis of vitamin D. I'm like, yeah, really? Okay. So what is the autoimmune that they had that the immunomodulator had cut off? So this much is what you need to look into. So when you're integrative, we cannot function with volume. You can charge more for your time. If you're seeing 50, 60 patients a day, charge more and see less. And let's look at more of a pathway towards curative. Nobody's promising cure. But at least, take time and decrease volume, and so that you be different. And so that they say, you know what, she takes time. That's all they talk about me. She takes time. That's it. 1 hour per patient, she takes time. That's all we need to do, and then you can charge for your consultation a little bit more if they can afford it. If they can't, we do for free. We do for, no, it's okay, just let's look into it, whatever is going on, because we need time. So there's one slider, subclinical, so I write my diagnosis. I write it, subclinical hypothyroidism, okay? So when it is subclinical, TSH is high, free T3-4 is normal, and free T4 is normal. So, but it doesn't mean that they are thyroid. I have so many patients with the TSH normal, but they are not on the thyroid medicine. They come back to me and said, if you're going to any other doctor, that's what it's going to happen. But it's your choice. You are still subclinical. Why? Your antibodies are negative. Your TSH is high, but your T3, T4 are negative. So you are subclinical. Doesn't mean. Talk about the diet. Put on the supplementations like selenium, zinc, and all that. We look into that. So, but still, the TSH will come down. Trust me, the TSH will come down. We have done number of cases. Don't, just because TSH is high, don't diagnose them as hypothyroidism and then, let them be on their medications for the rest of life. 4 times I test. Free TSH, lately one patient was 0.001. I still said, I am not diagnosing you as hyperthyroidism also. If you want to take a second opinion, it's your wish. 4th time, it's normal. So take time, when your antibodies are negative and the TSH is thick, make a log them, document saying that repeat. Don't just diagnose them. But subclinical hyperthyroidism also again hypothyroidism is again low. Free T3, T4s are low, with TSH is high. For all that, we need to look into all that in detail. Because normal thyroid metabolism requires trace elements. If you have subclinical thyroid, just put them on trace elements like selenium, iron. Look at the iron level. I don't like to prescribe iron as a supplement. I do go through by the diet. It doesn't mean that everything needs to take it as a supplement. Please to understand, calcium is not a supplement I would write. Iron is not a supplement I would write. I would correct through the diet. Because you don't know. Because for me, ferritin is an inflammatory marker. Iron is too much of iron increases the viscosity of the blood.
The ferritin is usually low in such patients.
No, yeah, it's low, but I'm just saying,
Yeah.
if we,
High ferritin is inflammatory marker.
but I'm just saying, if I give iron,
So in the low case you will give.
no, I will not give you iron.
7.5, let's say,
Still correct the anemia.
through diet.
Through, look into it. Why? Absorption. That's what I'm trying to tell. There is no data to it. So there are some things that you don't want to give because you have to look at the clue. So until 4 I don't. Hemoglobin 4, iron injection directly, not a blood transfusion, but I give iron if 3 or 4. But until 5, you need to dig into it. Why? And it will come back. It will come back. If you're not comfortable, 6, 7, you do the iron, but don't send them. But while you're working on it, but iron as a supplement item. As a supplement item. And if I need iron directly in my clinic, I give iron dose, calculate the dose, and they get an iron infusion. But not a blood transfusion, but they get an iron infusion if the patient is not comfortable. While I'm doing as a supplement, as an oral supplement. So if you're not comfortable with the TSH there, just say trace elements. Look at that and just give them some kind of a supplementation which is zinc, selenium and deficiencies which can affect. So this is basically what we look at the fundamentals, exercise, sleep, stress and relationships. Again the normal values. Everybody says what is the normal value, so I thought I'll just put one slide. We don't have reverse, I think only Delhi has a reverse T3. Reverse T3 testing. In the south we don't have reverse T3 testing, but free T3, free T4. Please look at free T3, free T4. It is not the total T3, total T4. If your protein is high, your total protein will be normal or high. It is because of the protein complexes T3, T4 is high. It is not the free molecule. Yes, it is little bit expensive, but do T3, free T3. If your TSH is abnormal, do a free T3, free T4, and an ultra-sensitive TSH. And if your city has reverse T3, do the reverse T3. But these are the results which are ideal, and that's should be. So your anti-TPO should be less than 10, and anti-TG thyroglobulin antibody should be less than 15. That's ideal for your antibodies. Again, it's the same slide. So why are these meridians are the same thing, whatever that cervical, lumbar levels, and this is what the complexes that we have, and this is the plexus in between. So we are now talking about plexus. So we are talking about, if at all thyroid, then which plexus is related to the thyroid, and that plexus, the so-called, is the whole chakra thing. And if you want to know the chakra healing, then heal that chakra for the plexus, but I will call it as a plexus. And then look at that if your integration, and if you have doctors who, the Ayurvedic doctors and everything who have that chakra kind of healing. So tell them what kind of chakra healing that they need, because you are talking about plexus, we need to think about the chakras also at the same time. So this is another paper that I go back. In 1964, one of the doctors said, mental illness leads to this attempt at theoretical integration with the relations of stress, emotions, and autoimmune immunological dysfunction. So back in the 1960s, papers have been published about stress and emotional journey can play a role behind autoimmune disorders. Why are we thinking it's only genetic? Why are we not thinking about the psychiatric journey or psychological journey that the kid might be going through during a childhood, or the mother might be going through during pregnancy? Why? This has been published, which has been completely neglected. And another paper back in Times, and again republished on the same data. In 2nd century, observed that depressed women were especially susceptible to breast cancers. So there was enough research before. And then they published their papers that saying that 2001 and 2010 and 1993, the T cell function and the NK cell activity is in depressed patients. So when you're having I have cancer patients, I do a psychosomatic sessions to all my cancer patients. They not only come for an IV therapy as well as an ozone, IV vitamin C. They do a consultation with me for 3 hours or 1 psychosomatic sessions. Every cancer patients get a psychosomatic sessions looking at their history one time and looking at their psychosomatic healing. So this is what is psychoneuroimmunology. So this is another data-driven and a buzzword called psychoneuroimmunology, because immune system, hormonal system, and the nervous system. Again, it is because of the nervous system, which is a sympathetic and a parasympathetic, psychoneuroimmunology. So this is a very, very common thing of your psychiatrist. If you are integrating with the psychiatric, this is what they talk about. So this is a normal brain, and this is a chronic stress with a pathology, and a chronic stress with cortisol resistance. There's something called cortisol resistance with stress. So that's where your stress, your cortisol resistance and your autoimmune disorder just doesn't get better. So adrenal glands, chronic and high cortisol release and a cortisol resistance, that's where your inflammatory immune cells are there, and with your autoimmune infections. So communication between immune system and the brain through signals through vagus nerve, through cytokines such as interleukin and tumor necrosis factor. So does yoga or any other non-stressful other than this thing do help? Yes, they do. They do help because of the afferent vagus nerve activity. So with whatever we do in terms of relaxations, in terms of exercise, in terms of healing, it is through autonomic nervous system correction that it can have different kinds of an understanding. So chronic stress causes your body to produce cytokines, again autoimmune, type 2, heart, others, type 1, IFNA contributes to systemic autoimmune factor. So this has enough data how a psychoneuroimmunology and an autoimmune dysfunction is related. Again, we have enough understanding about stress and how it can interfere with your ACTH and your, the nervous pathway of a cortisol, adrenaline, sympathetic and a parasympathetic reflexes. about central components that we have. Again, it's the same thing of key to carcinogenesis process too, because your DNA repair will not be like an apoptotic pathway can be interfered. Okay, so this is again direct relation and indirect relation. Best example is interaction is thymus. Thymus is responsible for maturation of T cells. So thymus is there only until certain age. What if a childhood trauma and a childhood disorders has already interfered with their thymus and which has interfered with their T cell function, which can be said to be one of the most important immune cells. And then so thymus inhibition or loss can suppress a good part of the immune response. So if you look at the other countries where they do thymus therapies, that's why they do, because we are born with an extraordinary thymus gland until a certain age because of the immune responses that do play a role. As other autoimmunes, they do get a thymus therapy because they have a tremendous production of T cells which plays an immune reaction. So pituitary gland organizes cortisol level, how circulating, organophospholic, all that, as an indirect relation, how your neuropeptides. So neuropeptide mediators are the behind this neuroendocrine dysfunction. So we have it, something called neuropeptide mediators have been shown to influence the immune function and immunity. So the sadness, anxiety also needs to get rid of it. How exercise benefits the immune response? By releasing cytokines and chemokines. So this helps in turn in your immune system, making it able to respond faster and more effectively. Exercise can have natural models so that you are not over responding to the infection. And in the other words, physical activity through physical and emotional means help your body trigger the right amount of immune responses to effectively shut down the function. So as much as the physical exercise, the mental activity is also equally responsible for the immune function. The reason that I put this slide is it's not the physical exercise, but it is the mental activity also plays a huge role. Because again, we have this same action, but has a different reaction because of the hormone. So in emergency medicine, we see if the pupils are constricted or dilated. Recently, one of the patient was like, was in love so much, and we was always having a, constricted pupil. I'm like, we has like, okay, maybe this kind of a subtle kind of an emotional responses can also be addressed by the pupils. That's what we thought. So another another doctor, Dr. Gavamate, is another doctor which has been intensively studied on emotional being an autoimmune disorder. That's what he says. When the body says no, a groundbreaking, when the body says no is a book of the name, explores the role of mind-body link in conditions, disease such as arthritis, cancer, diabetes, heart disease, and multiple sclerosis. So I happened to work with him for some time in US, and then it just opened another ray of understanding how an emotional journey do play a role of connecting with hormones, nervous system, and immune function. So again, same thing, ANS system, autonomic nervous system, as well as an immune system do play a role in RA, SLA, and systemic sclerosis. So without doing anything, only by psychosomatic sessions and a psychoneurotic pathway, SLA patients got better. We did not use anything in certain more than 10 patients in our clinics, and we just gave them enough amount of history, understanding, and a year of therapy in terms of a psychosomatic therapy, and SLA disappeared for that. So the published data. So non-pharmacological and non-invasive therapies. Based on the premises and substantial amount of data is emerging, vagal stimulation on the neuroinflammatory regulation, not only in the modes of endotoxemia, but also is the critical modes of autoimmune disease. So the new clinical trials have been going on, neurostimulators in RA, IBD. So vagal stimulations is quite a bit in other clinics there. So how vagal stimulation and vagal therapies are going, because that's where it is non-invasive and non-pharmacological. So this is what vagal nerve stimulation do play a role as an anti-inflammatory, as well as vagotomy again causes pro-inflammatory. So we have, this is the cholinergic term, which is balancing the immune homeostasis. So the vagal therapy, that's what you will see, that how vagal nerve stimulation can be non-pharmacological, non-invasive, which can be a vagal nerve stimulation. Again, sympathetic autonomic nervous system, vagal stimulation, again sympathetic and parasympathetic, how they can be an anti-inflammatory pathways and improve sweet qualities. Again, I thought this was like fascinating for me when I came across how a carotid plexus, the pineal gland, carotid plexus and pituitary gland, and how parathyroid, these are the chakras and their colors, and the cardiac plexus and how metabolism related circadian rhythm, hormone imbalances, and how the mental well-being issues, giving, receiving, love, personal power, self-will, intuition, wisdom, creativity, intelligence, and emotional balance, and survival, physical needs, and tribal association. So we really did this in our clinic, and it's just amazing results we have when we open up their Pandora of emotional journey, and we are just getting somewhere. So this is a new kind of an understanding how we have gone through to the emotional side. So this is one thing why I talk about amygdala a lot to my patients. Again, neonatal, and as we go by, this is a study which has been in 1970, 1988 and 2010. So this is the pathway how a neocortex, when it is happening as an anatomy, as an evolution, and the network, and the behavioral dominance and behavioral endotherapy. So because now in psychiatry, it's not about counseling anymore. It's behavioral therapy. It is about understanding and deep down saying that what kind of a behavior I was used to as a child, what did I adapt as a behavior looking at my father, looking at my mother. So what is the behavior that I automatically adapted because my neocortex and amygdala I just absorbed. But I don't like the behavior anymore. I just absorbed from one of my growing up, but I don't like it anymore. So it's our responsibility to how to rewrite that behavior as a behavioral therapy. So you acknowledge that what I don't like, and then you are re-acknowledging and helping the patients to have a new behavioral therapy. So it's not about counseling, oh you do this because it's not working for me. Because counseling for God, or you should do this, it is just not working. So what is the behavioral therapy of a psychosomatic sessions as you go deep down? So it's beyond counseling. It's not the counseling anymore what we are talking here. So yeah, so this is what Dr. Vipul is going to talk about. So I'm not going to take it more. So we could define most meditation as a parasympathetic gymnastics. So the meditation, how it's been accepted and how it's been, so much of this thing, it is a parasympathetic response. It is a parasympathetic response about how your breath work. People are talking about breath work now. People are talking about meditation in different kinds of meditation. It could be the parasympathetic response that we are stimulating our own vagal nerve by the day-to-day activity that we are doing. So it's the same thing, cardiac plexus, sacral plexus, how chakras and nadis can be, yoga posture that focus on psychic power and development. So psychoneuroimmunology again I'm not. So this is one slide how I came across long time ago, how an acute psychological stress, how a father is scolding a child there as a kid. The father doesn't know, okay, and we do it all the time too, okay, but how a physical injury can cause an infection by this mechanism about the hormone, the new hormone that has been reclaimed. So, and then followed by a response to trauma, a biological mechanism, gut dysbiosis, insufficient glucocorticoid signaling, which can cause obesity, suicidal abuse, poor sleep, and psychopathology. So as much as we are going from there, an acute psychological stress, how a psychopathology can happen. So potential mechanical linking, childhood traumas and inflammation. Because lately we are seeing a lot of autoimmune in children. Lot of autoimmune disorders in children. Skin and IBS and gastritis and Crohn's and ulcerative colitis. It could be neuroinflammation. So the inflammation and psychopathology is the next key, and how early life stress, the hidden wounds of a childhood trauma. And I did undergo this kind of a therapy myself, and I just did not know that they play a role of my own childhood trauma, and I just like, okay, I was in denial. But then it opened up different this thing. I was like, wow, this is like something else, and then we had to, and we integrated this in our practice. Because of one, I need science. Whatever it is, I need a scientific background. That's how we are programmed, kind of a thing. So we need science. So we looked into it, and there is an interleukin, there is an hormone called dorsal anterior cingulate cortex. So brain regions involved in this process include anterior insula and the DACC, and the result of this physiological expression of social environmental adverse can become a biological embedment and sustain a perceptions of threat for months or years, and after the original social environmental impetus have passed. Due to this stimulation of that part of the brain, due to a psychological stress, do play a role in the formation of interleukin 6 and tuberculin factor. So that is a short term, medium term, and a long term injury. And this has been published at the same time. We think that the short term is over, the acute episode is over, so we are not in that stressful episode anymore. But how did that short term injury can took me to a medium term injury as well as a long term injury, which could be a disease? Again, the same thing about social stress. What could be the social stress? Social evaluation, social rejection, social isolation, exclusion, and what part of the brain that is being secreting? Afferent vagus nerve pathway. So when the vagus nerve theory has been tremendously deep into this, you see the afferent vagus nerve pathway, how interleukin has been come, glucocorticoids and epinephrine has been played a new role, and the natural killer cells have been formed. So it's the same slide again, more into detail about acetylcholine and all of that. And this has been published after the SARS-CoV-2 infection. Interestingly, many of these changes can be triggered by psychosocial stresses, and this paper has been published in 2023. That how during COVID-19 pandemic has led widespread increase in mental health problems, including anxiety and depression, and why many people are coming up with these kind of things. So mental health, vagus nerve is one of the pathways that's central to health related mind-body interactions, lifestyle changes, non-invasive, true strategies. Vagus nerve function may in turn become a psychosocial resilience to it. Again, almost over. I'm sorry if I'm taking too much time. So the self, ego, brain, and immune system, this do play a role. Psychoneurotic study, including psychological process, nervous system. This is the article, kind of psychoimmunology, stress induced to prevent cancers of reoccurrence. We were discussing today with one of the doctors here, reoccurrence. Even though we do IV vitamin C's and ozone, the reoccurrence is still high. So that's where I started integrating with the psychoneuroimmunology, because we have to keep that in mind, maybe because its psychoneuroimmunology has not been addressed. The tumors have disappeared after the IV vitamin C and ozone, but they are coming back. Why? Where is the triggering factor? Is it this one? So I'm just making you think. So unexpressed emotions will never die. They are buried alive and will come forth later in uglier ways. This Sigmund Freud has been told. So unexpressed. So please express your emotions. That's why I talk loud and clear. Also come down. Thank you so much. So be calm, be positive, enjoy life, be silly, be silly, as much as silly you can. If you have children, there's your only opportunity to be silly, because they will become adults soon at the same time. Thank you so much. There is hope for autoimmune disorders. Thank you.
You can turn right, left, just twist your spinal cord small ligaments. If you can jump also. So little bit energetic, na? Yeah, now please be seated. Thanks. Because I don't want anybody to sleep during my lecture. So, अभी करने के लिए Okay. So good evening everybody. Good evening please.
Good evening, sir.
Good evening. So had your tea, no? Or having it? Okay. I would like to first thank Dr. Pavil Saiba, from whom I have learned. She hold my hand and we had Ozeathon, Walkathon, and then Miliben and Jignasha Ben has shown me the direction and upgradation. And many of you also, I have learned so many things, so thank you all. We go to the topic. With the blessings of God Dhanvantari, would like to share few things. My topic is integration of ozone therapy, Ayurveda and Yoga for autoimmune diseases and infectious diseases. I am audible?
Yes, sir.
Yes.
Okay, thank you. So this is the basic one word from Ayurvedic text 5000 years ago. Science is science. How it is good, bad, it depends upon the person's intellect. Science is always good if you use it that way. Same water, same weapon, and it is true with science also. Second, at that time also, they were very open. They have completely mentioned, okay, don't study science unidimensionally or anything. You have to need to take help of so many things at a time, so many sciences at a time, and then you can use. I use this law, you never make the treatment worse than the disease while using integration. Because I have suppose 7 things in integration, but I don't need to use each and every 7 things in each and every patient. So now we'll move on to infectious diseases. See what I am going to cover today. Few patients with infectious diseases, integration of the medicines. Then second, autoimmune disorders, and then a part of yoga. Dr. Sudha has already mentioned it. It will be totally different from that. He has cleared the background and fundamentals of all of us. So next journey will start. So in this I am going to present 7 small cases: non-healing ulcers, osteomyelitis, pot, spine, liver abscess, abdominal abscess, breast abscess, so many things. These all patients were taking treatment from surgeon, from the hospital. In spite of that, they are not well. So they turn towards integrated approach. So this patient, old patient, 2009. I started ozone practicing I think 21 years ago. Before Ozone Forum of India was established, I was using ozone through Bisleri Trust only, but the name was not there. So this patient has 10 toes amputated 2 years back. See the complicity, 10 toes, all the toes has been amputated 2 years ago. Now the wound was not healing. So he was advised again amputation above ankle. This was the wound. The date has been mentioned 16th of April, and you can see the sinusa from this end to this end. There was sinus formation and the whole wound was there. So after giving ozone bagging, see after 1.5 months, 20 of June, see how the beautifully wound has healed. And this is after 1 more month, 20 days. So same patient turned to me after 10 years. 10 years he was absolutely fine. So when he came to me, he was again advised amputation. So he remembered, no, Dr. Vipul is there, he has used some ozone, so let's go to him again. After 10 years, in between he was gayab totally. So fever, septicemia, WBC count was 24,500, too much. And he was admitted in the hospital. And he took discharge कि मेरे को अपना पैर कट नहीं कराना है, कुछ भी हो जाए. So WBC count, creatinine was 3.5, RBS was 480, HbA1c 14. So all red flags, difficult to treat in the clinic. So I started the treatment after the 3 weeks. WBC count came down 9600 from 24 5000. Serum create came down to 2.5. RBS came down to 230, which was not very difficult to bring it down. See the conversion tissues. There was in this picture, this is the necrous bone and this is the tendon, infected tendon. So we all know this is a type of gangrene and wet gangrene. It is very difficult to treat tendons in infected wound. So after 40 days, see how the beautiful wound has healed, and you can appreciate the color of the wound also and the skin also. See how black it is in the first picture. It is little bit better, and see how beautifully it has healed. So definitely the ozone and integration has worked remarkably. What the treatment has been given, green is Ayurvedic part and sky blue color is ozone part. So 3 times a week I was giving ozone with 45 micrograms. The dosages are absolutely standard dose as per the ozone pharmacopoeia, no variation in that. Ozonated water and rectal ozone I was giving, dressing with ozone oil. Within 6 weeks the wound has healed. And the Ayurvedic treatment I am not going to elaborate. You can just take a photo who are Ayurvedic doctors. We can discuss afterwards. So next, So next patient is of complete occlusion of anterior tibial artery. Gangrene was there. Patient was in same septicemia. Creatinine was 2.8. WBC count was 22,000. The wound was too bad. Fluid discharge, bad smelling, temperature was there. Patient was having paresthesia. I told it is difficult to treat such patient, but still we will try. Patient was already on the antibiotics. He was admitted in the KEM hospital, then in the Bombay hospital in Mumbai itself. But they told again amputation, but it is not possible as creatinine is high. We cannot do CT scan, so wait and watch. So he came to me. I started for first 5 days. We do Panchavalkal Kvat Dhara. The content I will display, so nothing to worry about that. The decoction we prepare and we just pour on the wound, running water. It gives wonderful, fantastic results. So twice a day, I told it twice a day. Then ozone bagging rectal and that was done. So after 5 days, this is the Panchavalkal Kvat content. You can just Google it or you can just photo it. Okay. Next. So this was the photo after 5 days of the treatment. Because I was very assured that I am not going to help him. So at that time after 5 days his creatinine came down to 2.4 from 2.8. WBC count was better, discharge was less, swelling has reduced. So again we have continued the treatment. I have amputated 2 toes in the clinic itself because total paresthesia was there and it was hanging, no bone connection was there, no artery connection was there. So it's the orthopedic job, but being a general practitioner, I did it in my clinic itself and patient was ready. And in spite of spending 2.5 to 3 lakhs, he spent just 10 to 20,000 and his wound has healed 100% within 2 months. See, this is the photo after 2 months. Out of that, he has used 1 month ozone and rest some Ayurvedic treatments and see how beautiful the wound has healed. He was having complete paresthesia. In such condition, neuropathy, we use Gomutra Dhawan, that is cow's urine. For you can just apply it just like oil massage in the upward direction. We use that. If kapha is more, patient is too much of obese, then we use this. If patient is not that obese, then we use Panchavalkal Kvat Dhara. Again same. So it gives wonderful results. Now green is Ayurvedic treatment. This is ozone. And so shall I go next? Because I have so many slides. This is osteomalacia. Dr. Shrikant's patient. So I have treated 5 osteomalacia patient. Out of that 4 are doing absolutely well without surgery. One I don't know what he has done. This oozing was there since 2 years. Operated by ortho but no relief. So now advise surgery with amputation. This is Ayurvedic treatment which I have given. CPV Chandraprabhavati Arogya Vardhini. We will leave that aside. Ozone IV once in 15 to 20 days. He has continued this for 6 months. And local bagging when he was coming to me. And the wound has healed, sinus has healed, no oozing was there. Now 5 years have passed, he is absolutely fine. And patient ran away after that. He didn't repeat the X-ray. What is the internal condition? But see the wound, see the leg. Here he was having a discharge from this place and this front and posterior side. And see how beautifully the wound has healed, sinus has healed. So next is osteomyelitic abscess, cold abscess of second rib and middle finger with osteomalacia. So double. It was cold abscess also and osteomalacia also. Patient was already on AKT. Antibiotics, dressing were going on. Culture was negative. So, but there was relapse again and again. So she was advised again operative procedure third time. So I started giving ozone local injection at that site of the abscess, and within 7 days the wound has healed remarkably. She was continuing AKT, but this was the main thing. I just inflict ozone in that local area, that's all. Around 2 to 5 cc, 20 to 30 microgram of the ozone. So cold abscess, this is the next one more patient of cold abscess. She was from Vasai, 2 cold abscess in the abdominal wall. She was under AKT, surgery has been done. In 2008 February she was diagnosed and AKT was on. This is the report of after 2 months, April. She was having now 2 abscesses. Previously 1, now 2 abscesses and increase in size. So with the sinus formation. So I started the ozone after 22nd April, injection of the ozone in that cavity and sinus, and bagging was done. See, after 1 month or after just 20 days, see the 1 abscess has gone and 1 abscess remained, it has reduced in size 1.3 by 1 centimeter, and sinus has shortened. And after 5 more sittings, now alternate days, complete resolution of the abscess, and very small sinus was there 1.6 centimeter, and it has resolved after that. This is liver abscess. This patient was from far. He was a son of one of the MBBS doctor in Mumbai. He was having 2 abscess in the liver. He took the treatment in the hospital, IV saline and everything. So he was of acute condition. He was not having fever, no pain, nothing. But after the sonography, he was having now 4 abscesses. So he was worried. I have taken IV antibiotics and everything, and still it is not going. So something is wrong. So now we need to do something. And doctor has advised surgeon that we will do FNAC or we will just aspirate the pus from the liver, and then we'll decide what is to be done. Culture and sensitivity report. So I started the Ayurvedic treatment. Patient was little better, but not very better. So I added ozone rectal insufflation, and see the report. After 20 days of the treatment, now only 2 abscesses were left. 2 were completely healed. And patient somehow stopped taking the ozone, but after 30 days there was no abscess found. So within 20 days of the ozone rectal, the patient has shown given wonderful results. This is breast abscess, lactating woman, abscess of 4 centimeter. As she was lactating, she was not ready to go under surgery. So I have aspired the pus from the cavity and injected from the same needle ozone 20 microgram, around 5 to 7 cc, because aspiration was around 10 to 15 cc, and started some Ayurvedic treatment. After 7 sittings, there was no discharge from the nipple which was there previously. Size of abscess has reduced on sonography, and after 10 more sittings, the abscess is resolved completely. This is pre-treatment sonography, post-treatment sonography. She had taken antibiotic. After that, I have stopped all the antibiotics as it was not showing any results in the abscess. Next is a umbilical abscess. This was little deep muscular layer in the subcutaneous and muscular layer of the abdomen. The abscess was small 2 centimeter, but the sinus was 2.4 centimeter. Ozone bagging started. Same aspiration of the pus, then ozone putting into the cavity. Then remarkable improvement has been observed. Discharge reduced after 2 sittings, oozing stop after 7 sittings, and complete healing after 10 more days. This is how I have done in the OPD. Then fourth spine. This patient was having 61 C2 cervical spine, around 4.5 centimeter cold abscess. With all side effects of AKT, she lost 11 kg after 1 month of AKT. Still she was not recovering. If you can appreciate, this was the photo when I home visited her, and I started ozone treatment, rectal insufflation and water at home itself. I used to do this. So at that time, after 2-3 applications, she felt better, giddiness reduced, pain was reduced by 70%, LFT, RFT which was abnormal, now coming down to normal, anorexia vomiting has stopped, and patient has gained 2 kg weight within a 1 month. So definitely remarkable improvement with AKT, no doubt. After 1 month she came to my clinic, this is the photo. She started walking, and after the 3 months of the treatment and some Ayurvedic treatment I have added to that, you can take a photo. MRI was showing abscess has reduced to 1.5 to 1.2 centimeter with weight gain of 5 kg, and how she looks. And after the completion of treatment, after the 4 or 6 months, I think she was absolutely fine without any abscess. So this meningitis girl, 18-month-old girl from Faizabad, she came. Her weight was 6 kg when she came to me. 6 kg, 18 months girl. She was paralyzed, drooling saliva, fever since 2 months, left hemiplegia, and having history of epileptic attacks post-infection. So she came to Bombay hospital, and CT scan was showing some generalized edema, some ischemic effects. Hospital people told me we need to do CSF and many more things. So it will cost you around 2.5 lakhs. So you admit her. Patient was very poor. So I started the treatment, taking God's name. AKT was already going on. Gardiner was going on for epileptics. Antibiotics was going on. I started ozone and Ayurvedic treatment. We see her left extremity. She is lifting, but she cannot lift. And she is repelling with right hand. We see next video. This is more clear. She is holding with right hand. She is not able to. She is unable to hold above the shoulder. And after 2 weeks of treatment, now she is starting repelling. See, she is using her left hand and uplifting also. And after 45 days, she started walking and holding also the thumbs. Can I get a glass of water? This was one of the miraculous for me also. Now she is around, I think, 15 or 18 years old she is. Just last month she came from Faizabad to meet me. Baba doctor, I am alive and I am doing better now. Now autoimmune diseases. Infectious diseases over. All 7 cases. Hyperlipidemia. Does it come under autoimmune? Mostly no, but this patient was yes. Dr. Neha is there, I think. She has left. She was doing IV. Ex-patient was from Mulund. His triglyceride was 950 and it came down to 670 with statins and fenofibrates. Okay. Cholesterol was 435. It came down to 380 with the treatment. DM, diabetes was there, but HbA1c was 6.8. Statins was going on. He was under the treatment since 2 months, but 670 और 380 के नीचे नहीं जा रहा था. Stagnancy, and he was unfit because he was in a merchant navy. कि इतना अगर ट्राइग्लिसराइड ज़्यादा रहेगा तो he cannot travel, so he was just घर पे बैठा था 1 महीने से कि मेरे को जाना ही है करके. Then at that time I started Ayurvedic treatment we called Langan. You can interpret as a fasting, but there is a vast difference in fasting and Langan. Fasting, if time permits, or even next conference, we'll have got on fasting, Ayurvedic fasting. We use Chadangodak or any type of different decoction. Chadangodak is very important decoction in that. And with that, I just started ozone IV saline twice in a week. 5 he could complete. And this is the content of Chadangodak. If you can just click, because it is useful in digestion, improve metabolism, excessive thirst, fever, detoxification, diarrhea, delirium. So many places you can use this without thinking, because it doesn't have any harm. From 1 day of the child to up to 100 years. Sorry, I think I forgot to load the photos. And I have it. So after 21 days of the treatment, 5 ozone saline and Langana, triglyceride came down to 235 and cholesterol came down to 270. So from 670 it came down to 235 within 21 days, and cholesterol 435 to 270 from 21 days. So he became fit and he went. So next, this patient is my student. She was from a doctor. She was having granulomatous mastitis. Gynecologist has tried everything, and after surgeon has tried everything, but it was not coming down. So we started some ozone water bagging, then some Ayurvedic treatment. We call it Jatamosi-Panter, Asapacha, that way. So see, this is the first photograph before treatment, and this is the after treatment. She has improved 70%, 60%, but at 20-30% she was not improving after 6 months of treatment also. So I thought something we are lacking behind, and she started doing acupressure, and after within 20 days of acupressure the woundness will complete. So just I want to mention the integration, what and where and what will help, that you have to think and decide, and all depends upon the destiny. It is not that this will work or that will work always. So vasculitis, inflammation of the blood vessel, pain, redness, enlarged lymph node. This patient was taking treatment ozone since 2 years from our ozone from doctor. She was taking treatment under autoimmunologist from Bulun Fortis Hospital. Still she was having these all episodes. She was under immunosuppressant also. Still she was having such complaints. So I just started Ayurvedic treatment. This is the photograph, recent photograph, 23rd December. See the swelling and the lesions. And after just 10 days of the treatment, see the swelling and the lesions. And the pain was absolutely gone, 100%. So in this we added some Ayurvedic treatment. We called that is a Rakta Pachak and Rakta Pachak Chikitsa, and a little bit of intermittent fasting you can say, but it is Langana. Depending upon the patient's prakriti, we did that. So next is ADEM, acute disseminated encephalomyelitis. Difficult name to pronounce. ADEM, the rarest autoimmune disorder. So this is the paper of neurophysician from Kalyan. He has mentioned the patient was having ataxia, gait was bad, giddiness was there, some involvement of cerebellum response was there, query demyelination of the nerves that way. So this patient and post vaccination, right-sided ataxia has increased. So detoxification of the vaccine. Patient was a known case of hemiplegia since 1 year, recovered partially. Right-sided ataxia was there. Neurological gait, unable to do a daily activity like cooking, washing, grooming, cleaning, walking. So she was unable to do anything in short. So after the treatment, and she started improving very slowly, and 90% efficacy and improvement observed after 1 year of the treatment. She was continuously 1 year for the treatment, and she started cooking, washing, cleaning, everything, and now she can travel alone everywhere. So the treatment part, 30 days rectal ozone with ear and water, once in 10 days IV ozone saline, 3 times a week after that, then reduced to once in a week. She has completed the treatment for consecutive 2 years without any interruption, and we can see the results. This young boy of 20 years, demyelination of nerves, this was his second episode, Sagar. He was admitted in the hospital, given steroid injections, but he didn't improve, so he came to us. He is coming these are his reports and discharge from the hospital. This is when he came to me first time, after 2 days actually. She is unable to hold and lift also without support. Okay. Now this is after 5 or 7 days. He started walking, but limping was there. See, left lower extremity. Then after 2 weeks or 3 weeks, he was little better. And see how beautifully he walks. So the treatment given ozonated water, ear insufflation. He is still continuing the treatment. Now I think 8 or 10 years have passed. No relapse, but he still comes once in 6 months or once in 3 months. He is following some Ayurvedic lifestyle, some yoga asanas which I have advised, pranayama and Kapalbhati, and he is absolutely fine. So this is multifocal motor neuropathy or ALS. She was unable to lift up her upper extremities, and after 12 sittings she started lifting. But she was from Dubai, so she just left after 12 sittings. I'm doing a little fast. This is OCP, ocular cicatrial pemphigoid. Leroy is there, Leroy? He is there. This specialty, ophthalmology. So patient was complaining of excessive dryness since 12 years. Irritation due to that corneal ulcers were there. We call Dahakandu, itching, burning. Known case of allergic rhinitis. He was autoimmune diagnosed. We consider this patient as a Rakta and Pitta Dushti. So I started ozone IV and ear insufflation, some Panchakarma treatment, Vaman and Virechan, detoxification we called that as, and some Ayurvedic treatment. See, previously conjunctiva, subconjunctival fibrosis and congestion, and here also congestion. Okay, this is the date is 29 February 2024, and this is 19 April 2024. Congestion resolved. There was no congestion at all, and he was suffering this since 12 years, and he was having corneal ulcer due to this congestion and friction. So now his dry eyes had become little bit wet, and he is now off treatment since 6 months. Still he is absolutely fine. So this patient, I will skip autoimmune disorder. This was having. We go ahead. So yeah. So this is the Ayurvedic diet. Ki pathyam. Pathyam means ki just not diet. Diet with regimen. Daily how you have to be active, or what you have to think, what you have to do, what you have to eat, how you have to eat. And it should be, जितना मैडम ने told कि मन को अच्छा लगने वाला होना चाहिए, वो शरीर को भी अच्छा लगने वाला होना चाहिए. And then you need to explain this both the things to the patient, as Dr. Sudha told now. कि counseling is very important part, and then patient follows the guideline, and then patient becomes all right. So in this now the next session is in Ayurveda we have been advised कि lust, grief and fear will increase your vata. Anger will increase your pitta, and attachment will increase your kapha. So when kapha is increased, attachment will be more. When attachment is more, kapha will be more. It's a vicious cycle. So we can consider vata and pitta as a sympathetic nervous system. Just for example, it is not 100% true, and kapha as a parasympathetic nervous system. Suppose you can consider this, so it will be easy to digest. So if you are in lust, grief and fear, the vata function is damaged totally. So you have to suffer all that things. Whatever vata does in the body, that everything will be damaged. Now what is doing, that I am not going to cover here, but just a thought. 3000 older has been studied, and if you do these 5 activities, then 60% chances of Alzheimer's are less. This has been just recent study. So mostly we do 1 or 2 things. So we are 37% better, we won't get Alzheimer. But here they have written following the Mediterranean style diet. So this is our traditional diet. Only then that will help. Just nutrition, just amino acids, just protein. No, you have to change your diet with season, with your prakruti, with your disease pattern, everything. Mood disorders, we know GI tract has direct involvement with your brain. So brain gut axis, now we all know it can cause depression and schizophrenia, everything. Chronic stress, already Dr. Sudha has covered, it is not good. It has some apoptotic changes. It can cause TIA, it can cause CVA. So stress is normal. Stress is normal? No. It has to be there or no? See, actually the stress we consider कि कुछ बहुत बड़ा क्राइसिस हो गया लाइफ में, कि वो स्ट्रेस आ गया, कोई गया या कोई किसी का कुछ लूट लिया या भूकंप आ गया, earthquake. It is not stress. It will come occasionally. Corona will come occasionally, 1 in 100 years. This is not stress. But the small things we do every day. कि मैं यहाँ बोल रहा हूँ, कैसा लगेगा इनको, वो तो सो गए, वो तो चले गए, मैं बोल पाऊंगा कि नहीं बोल पाऊंगा. So this is a they will appreciate me or not, मेरा इंग्लिश अच्छा है कि नहीं है, बीच में हिंदी बोल रहा हूँ, इनको क्या लगेगा, इसको आता नहीं है. This is all stress. So uncontrolled speed of thoughts is stress basically, nothing else. And this we all have. We'll see scientific data also. And difference between expectation and reality. I can do these 10 things, but I am expected to do 12 things inside also, and my spouse or my child will say, "Nahi, Papa, father, you can do 15 things." So 10 I am doing, 2 is my expectation, more from me, and plus 3 from my family members. So this 5 is a baggage of stress over my head. So happy chemistry we all know. Now this is a new concept, psychobiotics. The next generation prebiotics for the brain, neuroactive compounds. And this is called as a novel source of psychobiotics. We were knowing prebiotics, probiotics. Now this is the new psychobiotics. This is paper published. This is not just my own theory. So short chain of fatty acid producing prebiotics, a novel source of psychobiotics. What it contains? Butyric acid, acetic acid, propionic acid, that's all fine. But what? Fruits, vegetables, seeds, cornmeal, some millets, some cereals, brown rice, apple, cheese, butter, A2 cows, milk and ghee. So these all will help as a psychobiotic. Now mind-body connection. In 1950, Dr. Wolf has studied this. He has given a tablet which induces vomiting for the treatment of vomiting in pregnant women. And just he has counseled. He said you will be better. This is the best medicine in the world. This is the costliest medicine in the world. And the patient has stopped vomiting. 1950. He has studied this mentality of ours. And according to the research, person has around 60,000 thoughts. So in 1 minute we have around 5 to 6 thoughts. Everybody. So see how much we are thinking and what we are thinking. And out of that, the best part is what? Bad or bad? 75% of these thoughts are negative. And 95% are repetitive. मीन्स आके मेरे को ये करना है, आई नीड टू डू दिस, आई नीड टू डू प्रेजेंट. अभी यहाँ मैं बैठा था सपोज, कम से कम 10 तक मेरे मन में आ रहेगा मेरा लेक्चर है, मेरा लेक्चर है, मेरा लेक्चर है. हाँ, तो पानी पी के आता हूँ, लू जाके आता हूँ. So this is what ना, तो भी ठीक है. When I was coming here for lecture now 10 years, 15 years ago, this was coming around 100 times within 1 hour. Now it came only 10 times in 3-4 hours. So I understood whatever I am presenting now, I am following. So I wish you all should follow this. So many negative thoughts. Now these negative thoughts, now one research is there. It has been done in UK. Suppose you are just playing football for 20 minutes, and your functional MRI has been done. The changes in the MRI, they have kept it aside, and just they have allowed 10 people group. You just close your eyes, and you all are on the ground. And you are playing football. You are kicking, he has passed the ball, he has kicked the ball. You pass to this guy, you pass to this guy. Just commentary was going on. Same 10 people and same 10 people, functional MRI was absolutely same. So whether you play the game or you don't play the game, you are just thinking, so it will going to benefit or harm your brain. We don't कि हम तो कुछ करते नहीं है, लेकिन यही तो हम करते हैं ना दिन भर. So and this activates our sympathetic system. बताओ तमें क्यों 10 मिनट 5 मिनट 2 मिनट. Okay. So new study has suggested we have 60 to 100 types of thoughts. It varies from 60 to 100 to 60,000, 70,000, and it is types. This has been studied on functional MRI. This type. So repeated is not different type. It is same thought. So how many times we are repeating? You can just imagine. It's a recent study, 2020. So focusing instead on frequency. This is the when you watch movie, still you have some different type of thoughts. When you at rest, you have many different thoughts. When you are in congestion, you have different thoughts. So it is important to know. And what Dr. Sudha told, you did not depress or suppress your thoughts. You need to work on that. You need to clarify. So your thoughts can release abilities beyond normal limits. This is an experiment was done. I will skip this. You can search online. एक मिनट में बोल देता हूँ फटाक से. They have created wounds. एंड आफ्टर 28 मिनट्स इट विल हील। ऐसे 3 ग्रुप को बता दिया था। हाँ, आफ्टर दैट देन they have stated कि every 2 minutes alarm will ring and you have to write how wound is, how wound is. हाँ, तो 28 minutes was given, 3 groups 10 suppose. तो एक ग्रुप को what they have done कि 28 minutes का अलार्म जो होगा 2 minutes का, they make it 4 minutes. हाँ, तो और जो जिनको बोला था कि आपका अलार्म 2 मिनट बजेगा, they make it 1 minute. So in one group they have double the time, in second group they have half the time, and in third group they have kept the same time. The wound healing was better in 14 minutes, absolutely normal. इनका टाइम हाफ कर दिया था। Means कि everything depends upon your system thinking. मेरा wound heal हो रहा है, heal हो रहा है। They have thought that way. Within 28 minutes, alarm was ringing every 2 minutes. They are keeping the data. और 28 minutes का 14 minutes में wound was healed. And जिनको double time दिया था, उनका wound heal हुआ after 48 minutes. So see how the game we play always. This is covered sympathetic, parasympathetic. We all know. The sympathetic nervous system also shut down many times when we are in stress, anxiety, fear, anger. Parasympathetic systems shut down. So parasympathetic, sympathetic, we all know it is rest and digest. Suppose we are in fear, we are watching TV, we are doing some phone calls while eating, or we are just rewinding our mind, क्या हुआ कल कैसे हुआ, and all that thoughts. Then our digestive system, our enzymes are not going to come, and you are bound to get some acidity or anything, whatever you say. So rest and digest if your parasympathetic is good. And suppose this fight and flight mode is there due to sympathetic system, and digest and rest mode is there due to parasympathetic system. Now this is a function we all know. Now how you can improve your parasympathetic activation? So by diaphragmatic breath. We all know infant child how they breathe up to 3 to 6 months. Their abdomen is always, and this diaphragmatic breathing has been taught to militarians also. Why? Because they need to recover very fast. If you are tired, you just try diaphragmatic breathing. Just take out while breathing in, just take your tummy out, and while breathing out, just take your tummy in. Do it slowly. Within 10 breaths now you will feel relaxed. And when you are tired, now what we do? This is what abdominal breathing, diaphragmatic breathing. Nothing else. Deep breathing helps definitely. Anulom Vilom Pranayam, meditation, this all will activate parasympathetic system, but does not activate, it will coordinate with sympathetic nervous system, and it will slow down. And Kapalbhati actually activates sympathetic nervous system for a while. So it will improve your heart rate, it will improve your hypertension, temporarily increase, but when you go in next phase of relaxation after doing Kapalbhati, then your parasympathetic will be charged 2 or 4 times. If you don't relax after Kapalbhati for 1 or 2 minutes, then your sympathetic will be charged. So we all know asanas only just for ki yogasan means asanas, postures different. No, it is 8-fold path. Ashtanga Yoga. It is for physical well-being, mental clarity, spiritual growth. Now there are 8 paths. 8 paths means what? First Yama is there. Yama means what? It is values for the society, moralities. I don't go in detail. Then second is Niyama, is self-discipline. It is for internal cleansing, physically as well as mentally. Then third is Asana, which we practice. We think yoga is just asana. First 2 are there, compulsory. Then third comes asanas. Then fourth comes pranayama. After this fourth, then comes the isolation pratyahara. In that you introvert, and by external sensory motivations, you introspect yourself. Suppose COVID was there. Around 5% people were very positive in spite of having COVID in the family or himself. And 95% were, in spite of having not COVID in the family, they are very tense. So they are not very good with pratyahara, and first 4 they have missed, just they are doing breathing exercise and some postures. So that won't help. Second is dharana. क्या ध्यान रखना है, धारण करना है, उसको धारणा बोलते हैं, और धारण क्या कर लिया उसको ध्यान बोलते हैं. ध्यान अपने आप होता है तो उसको समाधि बोलते हैं. This is a long, this spiritual part I will skip. benefits of yoga, you can take photo. All scientific data, research based. Now Panchakosha, I do practice this, so I will speak 2 minutes on this slide. There is Annamaya Kosha, in that I include diet, then asanas, then some detoxify processes. Whether it is Panchakarma, you can use chelation or you can use some Kriya, Shuddhi, Kriya, Dhauti, Noti, Neti, all that. Second is Pranayama. Breathing exercise, breathing should be depth, slow, it should be rhythmic, very slow speed, and nostrils is important. Suppose if you are feeling very down, you can use your right nostril, which will stimulate the sympathetic nervous system. And if you are feeling very hyper and dead, you can use your left nostril, which will just calm down. It will improve your parasympathetic nerve. Second is Manomaya Kosha Dhyan Dharana. This will improve your emotional quotient by bhajan, music, dancing, classical any music, which will act on amygdala also, HPA axis also, and gut-brain pathway also. Researchers are there. And I do next is yoga counseling. What the Dr. Sudhar told. I do each and every patient counseling. At which level he is and what I need to advise yogic kriyas. Just we do yogasan, do pranayam, it won't help at all. You need to see the level. If he is in 3rd standard, give the food of 3rd standard. If he is in 10th standard, give the 10th standard food. And if he is PhD, like all of us, then we need to give them some research-based data. Then he will do the things. And what to do? Suppose he is very disturbed, then physical activity is better. He is little bit sound. Suppose you are chanting some mantra, then you need to visualize that mantra. Suppose you are speaking Shri Ganeshaya Namah, so Shri should be in front of your eyes. Ga, Ga, Ne. So either alphabet should be in front of your eyes. That should be the way. And what you are speaking, that you should hear. That is next type of meditation. And afterwards you can go to pranayama. Otherwise it won't help. Physical health important. Mindfulness meditation helps. They have done around 50 years articles collection. There are more than 4,000 articles they have studied. And what they have come out, this NFKB has been discussed in the morning lecture by Miliben, which deregulates NFKB can lead to cancer, autoimmune diseases and chronic inflammation. Ozone improves this. But pranayam, kapalbhati and asanas also can improve this, or meditation can improve this. Even CRP levels are better, CD4 count has increased. Then telomerase activity has been better after this meditation. So all scientific data are there. Okay. Just it was not affecting IgA and IgG. Rest all INL, interleukin 6 and 8 and 10 everywhere. Mindfulness has got very good results. This is a very good article. You can go through. It is explaining CRP, IL6, IL4, everything in detail. Brain behavior and immunity health. It is very good 10-20 page article. Okay. Published 22 only. Sudarshan Kriya, Shishi Ravi Shankar has done very good research. I think one of his devotees also here. So this is how it has reduced the stress, anxiety, depression. This is the one study. This is second study. It has blood sugar has come down, cholesterol, lipid has come down after doing Sudarshan Prakriya. Long data is available. Even in MS patient, multiple sclerosis patient, it has shown very good, promising results. EEG reports has been done, and if you do suppose Kapalbhati and you do exercise, both way you are going to reach endorphins. Why I am telling this? Because patient is not able to walk or do exercise or asanas. Just ask them to sit on the chair and just do Kapalbhati for 15, 20, 30, 40 minutes and then do relaxation. Endorphin will release, he will get the benefit of exercise. No problem. Slow yogic breathing improves left, right nostril. Research is there, how it affects different sense organs. Then olfactory, then neuroscience, activation of prefrontal cortex, improvement of cognitive performance with standing on one leg. Just standing on one leg, your cognitive function will improve. It will improve your prefrontal cortex. This slow breathing has reduced anxiety. This trial has been done just for 8 weeks. Still the results were very promising. Slow pranayamas with savasana may be incorporated into the routine care of this patient. Impact of short and long-term mindfulness meditation on amygdala reactivity. We all know amygdala. Everybody knows limbic system is the emotional center which handles our emotions, bad emotions mostly. So it shrinks, blood supply has been restricted over there due to this meditation or pranayama. A review on neuroimaging in yoga practice are also slow decreased blood flow in the amygdala and increased activity in the prefrontal cortex. So both are beneficial. How yoga affects the amygdala? This is the research one. Decreased activation, yoga can decrease amygdala activation, which can help reduce negative emotions. Smaller amygdala volume, which can make the amygdala less reactive. Improve emotional regulations, yoga can improve emotional regulations, which can reduce stress, anxiety and depression. Same more effects of, even it improves hippocampus, pons also. This is one more study. After doing 30 minutes of just pranayama in yogasana, this you will get increased gray matter, anterior cingulate cortex, function of connection of amygdala and prefrontal cortex improves. So many things are there. See, this is also important. Post-traumatic stress disorder. This we all, our patients are having. This is in hippocampus memory. This is the software, and you can improve your software by doing this activity or by reducing your thoughts. Pons, temporal parietal junction. Temporal parietal junction. When you are empathize somebody, you have empathy, suppose in yours, and compassion. This part will be activated. Suppose that thinking pattern is not there with you, suppose, then you can do this pranayama, then that center will be activated. So either you think good, your brain will work better. If you cannot do good thinking, then do pranayama yogasanas and then start good thinking. It's a vicious cycle. So either you do this or you do that, you will get the benefit. Om chanting has research, it has increased gamma waves in the brain, retinal limbic system, prefrontal cortex, vagal tone improves, just now Sudha told, allowed to distress. There are so many researches there. So yoga is beyond mat. We do mat. We carry our mat everywhere, here also and here also. It is not an hour session. It's a lifestyle from Ashtanga Yoga, Yam to Samadhi. It enhances our body and mind, cognition and function. It is at cellular level, it is within, not just external, and it won't happen in a day, but it will happen a day. Okay, so this is Sri Iyengar Guruji, late Angayar Guruji. He has introduced many different techniques. Suppose if you have back problem, cervical problem, you can do Surya Namaskara sitting in the chair itself. Don't just lift, just do Surya Namaskar on doing chair. So with the different techniques you can do this, and this is also a type of same posture. Intention you can do. So correct use of all therapeutic tools results in success, and success in treatment reflects the best quality of a physician. So we all are best physician. So any pathy, any integration, you add ozone, it will be better. But don't forget sympathy and don't ever forget empathy. So thank you OFI and all of you. Thank you very much.
Now, next lecture by Dr. Nazarov on Russian techniques for ozone therapy. Okay, and snacks are ready in canteen, but finish this lecture and while going home you can have snacks and you can do. Okay?
All technical problems was ended, and we will start my workshop together with Dr. CD from Chile. This is our representative and my pupil, my partner in India. So it is our presentation. Let me introduce myself. I'm the head of International Association of Medical Gas Therapists and Ukrainian Association of Ozone Therapists. Because historically, my interest to the medical gases started with ozone therapy. It was 30 years ago. So I have a big experience, and I can share it for you. Our workshop will be divided to two parts. First part is devices which is used in Russia for therapy with medical gases. And next is this method, new method of ozone therapy, which we use. And including a new kind of therapy like ozone hydrogen. We know that ozone therapy, of course, and hydrogen therapy appeared maybe 8 years ago as a new kind of therapy. At the beginning it was drinking hydrogen water, and after that inhalation, and another variant of therapy. And maybe 5 years ago appeared first scientific data, clinical data about using hydrogen therapy in form of intravenous injection of hydrogen saturated with hydrogen solution. We make a new step and using ozone hydrogen therapy together. And we start examination therapy with ozone hydrogen saline together. In one bottle, we mix ozone and hydrogen. Some problem appear because hydrogen therapy, hydrogen and cannot sterilize of water and needle and other, and we must every time thinking what happens if we make a hydrogen solution intravenous, because it's a very big risk of non-sterile. It is dripping with non-sterile liquid. But if we use together ozone and hydrogen, especially if we use hydrogen for sterilized system, needles, liquids, and after that add hydrogen, we can be sure that not problem connected with sterility appeal. So devices and methods. Let me start with devices. Believe me now, it is a problem to bring something from country which in war condition, and I am bring with me only this device. This device with some problem. This device is classical device for ozone therapy, which allow to you to do all kinds of ozone therapy, ozonated saline solution, autohydrotherapy major, and other. This device, so you, for example, selected
Enter the procedure parameters and
device have preset. So typical concentration of ozone in saline solution is 2 milligram or more, with no in saline. And the typical 200, but I can change, for example, 3, or food, so maybe 300, okay, and start. Device asks me connect, outlet with distractor, it is ready, and after that, device will prepare needed concentration of ozone in gas for preparing ozonated saline solution. On Western world, this method, ozonated saline solution, name it Russian method. Because the main method of ozone therapy in the Western world is autohemotherapy major. So name it Kim method of ozone therapy. But it is not true. Some difference exists between effect of ozone in ozonated saline solution or autohemotherapy major, and this difference appear very clear during the COVID period. Because some doctors in Italy, Germany, try to treat COVID illness with autohemotherapy, with high concentration and other, and the solution was not good idea because COVID, SARS-2, yes, do hypercoagulation of blood, and autohemotherapy major same. So autohemotherapy working like cooling for blood. Vice versa, this ozonated saline solution, low doses of ozone therapy, working as anticoagulation agent. So working much more better than autohemotherapy major. So we must differentiate this. So device informed me that gas is prepared. After that, we only please attention. Typically, procedure ozonated saline solution procedure consists of at the beginning we bound it saline, and after that drip. No? And what happened in this condition? Two processes started. This conversion ozone to oxygen, and concentration of ozone decreases. And another, if we start to this procedure, what happens if we saline leaking from this? The air goes to body and remove ozone from body. Okay? That's why in Russia we use mainly syringe needle method of prepare ozonated saline. Let's see. One needle is short, and this short have loop over this bottle, and liquid, not liquid from this. We can connect to the ozone. And no any risk that water can go to blood. And next long needle connected with after trap to distractor. And the next needle can be connected to the system. Yes? So this is three needle. This is three needle method. The main essence of this method consists of we reach needed concentration of ozone and bulb it urine dropping. Clear? Understand? So instead air, ozone oxygen mixture come to body and keeping concentration in needed level. So concentration of ozone in body not changes during the procedure. I have special examination in this process, and if you working with 2 needles, at the 10-minute concentration of ozone in bottle will be half comparatively with 3 needles. And this, in this variant will be constant. And after 20 minutes, 0 what will be if we work in 2-needle method of preparing ozonated saline. So after that, we only start, and device will prepare this ozonated saline solution, and in this this window, we see a calculated concentration of ozone. Calculated. So device have special formula for calculating. And after this process is stopped, now the device thinking that in bottle 0.2. After that 0.3 and 4.3. And if you maybe could check this, we have special inlet. And we can take water, connect, and push and measure real concentration of ozone. We can do it practically. Why this possibility is important? I don't know what the situation in India, but in Russia, I many times saw that some examples of ozonated of saline cannot be saturated with ozone. Why? I don't know. There are many reasons for this. Maybe some substance like heavy metal which destroy it of ozone. Maybe some a little organic compound which this is another one. Organic. Where organic compounds can, how organic compounds can reach this bottle? From distilled water. From distilled water. Organic destroyed, ozone destroyed organic and disappears. So I strongly recommend it for all. Check box with saline. So you have box of saline. Yes, we take one. Check. Does it saline can be ozonated? If yes, and the level of ozonation, maybe one ozonated saline solution can be reached 3 milligrams, another one. So you must correct the concentration of ozone for preparing, for properly preparing this liquid. So this is device. Our typical device, classic device. This is a new generation device which produces ozone. Тебе надо закрыть, потому что озон.
Now what concentration is going on in the bottle?
What? Which concentration?
Is going in this?
For what? For intravenous. We recommended no more than 2 milligrams per liter. And in gas, we must use 10, 20, it is different.
So that device is designed for ozonated saline enough per liter?
No, no. The thing is, you can do all procedures here, but in case of ozonated saline, when you say 10, for example, 10 micrograms here, what we get in the saline is only 2. Correct, 2.5. So what you need, the same value you can improve. So it will be that exact. You see now, it's been passed almost some 280 seconds, right? So you can see the concentration on this one is increasing. So it's calculating, for example, if you're ozonated for 5 minutes, the dose will be different. For 10 minutes, when it's completely full, you can stop giving the
Does they stop it or it will stop by itself?
No, once the concentration reaches the time where you say, right? For example, 3.
Okay, now,
You wanted 3 on here. So 3 will be there.
How does it know that what is the concentration in the saline?
So all calculations going inside.
Device thinking, what concentration must be for preparing
As a
saline
microprocessor, which is the all these calculations.
no, not side by side. Once it's prepared, then you have to start it with it.
No, normally we wait for 10 minutes right now. So the 10 minutes, every minute, when the concentration is increasing in that.
So it should be 10 micrograms.
Technically, in the device, if we set 10, we will be getting around 2.5 to 3. But we have studied that it comes around 1/4 of this is in the liquid right sir. But we don't know how much accurate it is. But here it shows it accurate.
So for 1 saline, you are giving 2.5.
Yeah. So if you want, we can
For orientation,
Liter, 2 milligrams per liter. We are taking how much? 500 ml. This is just for 500 ml or 400.
Yeah, this is fine.
You didn't reduce. The needle is big.
Yeah.
for orientation, you must keep in your mind that relation between concentration in gas and concentration in liquid is like 1/4.
So we can see it's 3 already. It means
Only 20-25% in water will be.
yeah. So
You had mentioned about hydrogen therapy for so any injectable form of hydrogen therapy is also injectable inside the joints.
Hydrogen.
Hydrogen therapy.
Hydrogen therapy, yes. In this device it is impossible. In other devices,
Hydrogen
possible.
yeah, it's both ozone and hydrogen, but it produces ozone without any air of oxygen. You just need to add water inside it.
And what about hydrogen?
Again, same.
Same
It
procedure.
splits the water into oxygen and hydrogen. Oxygen is converted into ozone. Hydrogen is used for hydrogen therapy. Ozone is used for ozone therapy.
So ozone and
This
hydrogen
is
do not
doing
react.
what device, huh?
No, sir.
No.
At this
Ozone and
certain-
hydrogen won't
you
react.
can use for separate therapies separately. Also, you can give it as same IV also. At this particular proportion, it does it.
The hydrogen can be injected. Can be collected in a syringe
Yeah.
and injected.
Yes, sir.
This machine is there available in India.
This is available.
What is the cost?
This comes around 2.5 lakhs.
So,
And you can inhale hydrogen also. And you can make hydrogen water.
How many ml of hydrogen will it produce per day?
Total milliliter.
миллилитр в минуту. Вот это дает, this device can to you only 100 ml per minute. But we have more powerful device and I will show you now in video.
Please select hydrogen.
For example, we try to measure this concentration. I'm not sure that this concentration is needed because we saturated it before. But the process of measurement is like this. So, this is sterile, and this is sterile. We must, before preparing, we must take a little And we finish. Connect the starter. And this is cleaning of device after procedure. And we have special window, the control of concentration in this. This is only one device in the world which can do it. Germany device and another device cannot do it. So, device asks me, fills the cells inside of the cells for this control substance. I am connected, push, and see this blue row, stable, and calibration the control board. Okay. After that, we extract this water. This water no need for us, and we can. And extract a little, say about this liquid, and device asks, fill the cells with ozonation saline. I do it. I show 0%, but this does not matter because this water is used. If you and water from another bottle, water must be from this water. If you agree, we can make. If we have volunteer, we can provide this procedure if somebody made it, and we provided it in full protocol. The menu of this device is saline, syringe, ozonated water, preparing ozonated oil with exact peroxide number. Not only ozonated oil. Oil with exact peroxide number. You put this peroxide number, for example, 800 you can change to for example, 2000, very strong heat. And volume of oil depends. And after that, device will prepare for you and inform you that the oil is ready. Okay, with this device, I think all problems disappear after my action. Or maybe somebody has questions, no? For this device. Have. Okay. This is.
This is in case of making ozonated oil. Yeah. There are different peroxide numbers. There is 400, 800, 1000, 1200, 2000. 2000 is something which is very high. So normally when we make ozonated oil, we don't run the device much because after 30 minutes we have to switch it off. So this can run for the whole day without turning it on. And when you select this one, it will calculate automatically how much time it needs to run for the given amount of volume of oil and the peroxide number.
Select the only volume of oil.
The volume of oil and peroxide number. Peroxide number is like the dose. For skin certain peroxide number, for mucus level certain peroxide number, for infection certain peroxide number. So based on that, you will have it automatically. For example, now let it be 50 excess.
Yes.
So it's preset.
Yeah. So so now it will show automatically how much minute it will take to prepare the oil.
Excuse me, can you show how to collect hydrogen gas?
Hydrogen
Simulation in the
We'll
engine.
finish
next,
it.
next
Where we are
device.
connecting oil? There will be
Yeah,
connected.
the regular ozone oil.
What if you mean by oxygen, like oxygen cylinder gets on? What is it?
That it's every device it happens.
No, but this device has special setting that it will stop at.
Preparation of the procedure is complete. Begin the procedure.
It
Да, конечно.
will show. It will inform that.
The device every time have 7 sensors inside. Concentration in water, concentration in gas, pressure, control level for water,
Is
for
it
gas.
connected to oxygen cylinder? It's connected to oxygen cylinder.
And if oxygen is pressure of oxygen decreases, device stop all procedure and I have not oxygen.
You can see. Showing peroxide number. So it's increasing. When it reaches more than 200, it will stop. If you set it as 2000, it will reach 2000, then it will stop. So you can see already within some few seconds it reaches to 3, right?
They're correct. We will have stop tomorrow and after tomorrow. And all questions, if appear additional questions, please wait a little and I will answer or get more Dr. CD, answer or no questions. So for this device is finished. This is another kind of device which we produce. This is another kind of machine. It is new generation of device. Device which produces ozone and hydrogen from distilled water. Oxygen cylinder is not needed.
Okay.
Not needed. Yes.
You can see water flow here.
Yes.
So consume this water for almost a month.
Yes. This device have inside high.
Ozone effect.
This is high-tech device which have special converter, distilled water to mix hydrogen. Do you know chemical formula of whole name? It is junior. We have big. No, like this. Device which have. I will show the video about. But this device can work in procedure, in regime of working with hydrogen. In this variant, you propose to use is leg. This beverage, hot beverage, we can prepare hot tea with hydrogen, separated with hydrogen. Or hot alcohol, or no, cold alcohol with hydrogen inside. It is very interesting because hydrogen alcohol cannot provide any harmful effect for its delivery. So you can drink it and in morning you will be suffocated with hydrogen alcohol. We have patent for detoxification of alcohol with hydrogen. And inhalation. Oh, for example, we select beverage and hydrogen pump to bottle. this bottle have valve
Oh,
inside. You can put to this not only this glass,
Small glass.
cup for hot and do it. And you can make in hydro inhalation.
Thank you, and camera. Use it for hydration.
Normally, we, if using this device, we provided ozonated saline solution plus hydrogen inhalation with one device. Okay, if you need it stop and select ozone regime, there are many kinds of regime is allowed to you. Oily water, ozonated water, ozonated oil. You can prepare oil with exact peroxide number, with special bottle filled with oil and prepare in ozonated oil. With exact peroxide number. For example, oil, select. The device asking what peroxide number you need. Oh, preset is 400. You can change and start. And connect this for bottling and device will prepare. Calculation. And for example, this water. Yes, looks you only connect. And but the main you can prepare insufflation. Which kind of insufflation? Rectal, vaginal, and air. With special tip. This device have distractor inside, and you can and do it. And vaginal insufflation. Concentration and preset exist. You can not thinking about what concentration I must use because preset exists. For example, for vaginal concentration of ozone is 10 milligram per liter. Correct concentration you can increase it for 40. And next. And device, if we start some concentration, device, this device have UV sensor inside. Do you know? This is not concentration which producer of this device dream. It is real concentration because we have UV sensor inside. And now we will see that how it happens. Tuning of lipid ozone concentration. And we see that this green row will move. When this green row reaches this red line, the concentration is prepared. And you can be sure that the concentration will be plus minus 5-8% deviation, but you need it. We see. Because in winter one temperature, in summer another, one room at one, so all different. How the producer can be make warranty of concentration, I don't know. without inside sensor. But this inside sensor you can buy in the market. It will be cost three times more than this device. Why? Because and that's why most of, I think, all producer of ozone generators cannot have ozone measurement tools. Oh, you can begin procedure because I needed 10 milligram, and now it is 10, maybe 11, maybe 9, like this. So it is the most, this is most important feature of this device. All our devices have sensor. So working with our device, you can be, we can believe that parameter of procedure cannot be 10% of needed. This is another device. Now about devices. Yes. For example, ozone O3 proof. This is professional level procedure. This is O3 drop, and it is absolutely new option. It is H2O3 procedure. Device asking you what concentration in gas you need. Oh, for example, 20, but you can change. Oh, for example, it will be 20. Time of procedure. This percent is 50 minutes. And the main, it is percent of hydrogen in water, which will be. Understand? Doctor, please attention. It is answer of your questions. Which protocol of this used ozone hydrogen? Yes. Now I try to explain it. So that's I demand your attention. We set concentration in ozone and concentration hydrogen in ozone solution.
This is percentage.
This is separately.
Concentration of ozone will be set, but in hydrogen there is no such concentration. But the proportion will be set as percentage.
Okay.
Yeah.
And
10%, 20%.
And if we start, device will try at the beginning set needed concentration of ozone, and after preparing this solution,
So the device is separate for hydrogen and ozone. The device is separate, or it is the same?
Same device.
Same device. There is no separate device for hydrogen and for ozone.
No, this is the separate ozone generator.
And for hydrogen.
All this hydrogen generator produces ozone also.
Okay.
Same purpose. Same.
This is the hydrogen ozone generator. It has the same one in the bigger size also, but he just didn't bring it here.
So now in that machine we have set hydrogen and ozone concentration.
yes, you will see.
Ozone concentration and hydrogen
Hydrogen
percentage.
concentration. And both will be
Bubble in the same bottle.
in the same bottle we can bubble ozone as well as hydrogen.
It won't react.
It won't react with the water.
This is research going on for past 5 years.
Because ozone and hydrogen form again water and.
That's what I was saying. We have backed up research for past 5 years.
Is there no separate hydrogen making machine? Separate from the ozone and
So the same device, that's ozone is the added advantage.
what
You
is
can
the-
take it everywhere without carrying a cylinder. So why not settle on for this?
What
Is
is
there
the
in India?
advantage?
Is there in India?
Yes,
Advantage of combining ozone with hydrogen. What is the advantages of
sir.
combining?
Boost the volume of antioxidant system
To push the antioxidant system.
to the maximum. What we found is in case of giving ozonated saline and hydrogen inhalation, the patient felt much better than taking ozone alone. Then, with some more advancements, we made it as it comes in the same line. So you don't need to do separately for inhalation. There's IV itself.
Is inhalation better or IV is better?
IV definitely better.
What about intra-articular?
Compared to water, inhalation is better.
Have you tried intra-articular injections?
Subcutaneous injections around the joint we have, right? So that is a piece of it. But till now we are just going with the IV.
We give hydrogen intra-articular.
So it can be done. There is not much technique. So now they are mostly focused on systemic.
For sure.
Where is hydrogen really making difference?
Guy.
Like
To show the video,
So anything
videographer is there.
anything
Here we cannot, only there in that plasma.
this combination works better.
What video? Laptop se video.
This guy have my presentation.
नहीं एक मिनट. This laptop cannot be connected. You have to, if you give it to me on my pen, on your pen, right?
Yes.
Tomorrow they will show the
I sent to him a pen drive.
Where is it?
From,
Is this yours?
this, yes.
But sir,
This, blue.
sir, we have to finish now in 10 minutes. I already, one hour I gave you.
Why you not ask another representative to
No,
do?
everybody was given half an hour.
Okay.
I can still, it's still 20 minutes more. 10 minutes more is there. You want to still show? I don't mind starting.
I need to show Russian method of therapy.
So how much time?
Oh, maybe 15 minutes.
Okay. By after that, see Dr. Singh, after that.
Yes, sure.
Where is this guy?
This is my laptop, I will send it.
But connection. Now I will show
Can I have-
five maybe short video about the main kind of ozone solution from Russia. Okay? For example, very well known
You be there only?
well known autohemotherapy major in our huh? You go? This is typical this is typical autohemotherapy measurement procedure, which our devices. This is the main our generator. It is new. And you can understand the essence of this. Stop. It is the main moment of the procedure, this blood suction to special blood pump, which we produce it maybe 18 years. This is peristaltic pump, which extracts this flow rate, and it is very short. this working pump, suction blood from my vein, and filling this sterile box, bag. And after that, we select autohemotherapy procedure, flow, with all parameter, concentration, and ozone. Preparing needed concentration, and ozone pass to back. So after this is bounded, yes, ozone with needed concentration pass to the back, and this start. And when this procedure is over, we return direction of pump and return blood. Normally it is 200 ml to the vein of patients. Okay. Understand? Do you have any question?
What is this bag made up of?
It is bag, we produce a special bag, plastic bag, sterile, hyperogenic and other, and you can produce the cost of this self-cost. For you, it will be $3 for one procedure. $3.
Is it resistant to ozone? Is this bag resistant to ozone?
Ozone with concentration, exact concentration.
No, is it resistant to ozone? Plastic bag.
What?
Plastic bag, is it resistant to ozone?
Resistant, no problem. We sell this bag 800,000 pieces and have experience 20 years. No problem. Okay, next. Stop. Cleaning, yes, but it is enough. Okay. Next procedure is IBU. IBU. What means IBU? IBU is extracorporeal blood oxygenation and ozonization. This variant named IBU. Why? Because this is Russian variant of IBU. We working in this area during 2009. The name, it is contactor, glass contactor, which contacts the lung with ozone oxygenation. It is a contactor is rotated, and ozone mixed with blood. This device has two pumps. One pump extracts blood, and blood moving to this contactor. At this preliminary, we make humidification this ozone, oxygen mixture, and I will go. As a result, we see blood moving from patients to the bottle. Bottle is rotated. And another pump extract this blood and return to another. This is procedure. The volume of this working volume is have the temperature stabilization on level 37. Okay, we producing thousands of this procedure. This procedure in the United States, our user demand $2,000 for one procedure, and in Australia, $4,500 for one procedure. I do this procedure every year, 3 times per year, and have active energy and that.
We can see that.
Okay. Next variant of the Russian kind of procedure. No, for example, it may be interesting to you. This is Ozon Cosmetics. It is a very beautiful woman which agreed to be model for this procedure. This is our oldest variant of device, and this video have maybe 15 years old. And this special additional tools which provide ozonated vacuum. Vacuum with ozone. It is absurd, of course. Vacuum is a vacuum, ozone is ozone, but we make vacuum massage with ozone inside, with very high concentration, 100 milligram per liter. No, it is the beginning, the exact point for treated, yes, and after that we connect the generator and this device, and this device making vacuum with controlled parameter, but this is not air inside jar. Well, for example, now this doctor using oil, but it is not needed for my opinion, but it is his protocol. And in this glass tube, vacuum with ozone, 100 milligram per liter. The same, the same is for this place, some big one, a jar with ozone inside. And this for this, we use subcutaneous injection, okay, and after that, working with big jar, and it is stria. It's the Russian word, it's stria. I don't know.
Stretch marks.
Stretch marks after delivery. You cannot remove this fibrosis little. And you can provide the IT Cellulite program and working with this is you see it in color because this vacuum with high concentration of ozone. Okay, next. Next. I try to show you that. Can you show presentation to gigabyte from my. I hope that you take. Okay. Now I show to you to our presentation about. I cannot now show to you video with our absolutely new device with name Ozon Unique, Ozon Unique, which can do anything and professional and powerful. And I can share my opinion. This device is like electromobile on the background of usual car. And often using, of course, ozonated oil. Yes. We have own product of cosmetic product. So, with xenon inside. This is another medical gas, xenon. You can see on our stove. And the video about absolutely new device you can see tomorrow too. But now a few words about how can be preparing ozonated oil properly, understand it. And I try to explain. This is standard technology. Olive oil, bulbing with ozone, yes, and smiling. And after that we receive initial oil, ozonides of triglyceride of oleic acid. And there are many harmful substances like aldehyde, ketones, spirits, and others. And it is not so good. But what happened after? These ozonides, you eat initial oil. And what happened? We have a harmful substance with a little amount of preliminary produced ozonides. Understand? It will be happen after maybe 2 week storm of ozonated oil. How to prevent this situation? For example, it is okay. Our methods of preparing, properly preparing ozonated product from fatty acid. We use initial olive oil, extract triglyceride of oleic acid, and saturated it with ozone with special condition. As a result, we receive full saturated substances, so named clear ozonides, and some layer of harmful substances. Why they divided? Because this is full different substances. We can divide it and receive practically clear ozonated triglyceride of oleic acid. Yes, and but it is very strong. The peroxide number like 2,400. And after that, we dissolve 2 kinds of carrier. One, it is vaseline. And with exact concentration of initial ozonated substance with natural carrier with different peroxide number which can be used for different conditions of organism. And special substance with named balm. This one of this. And oil and the balm you can see on our stock. And another kind of interesting thing, it is liquid suppository. It is pure ozonides with vaseline oil, and you can use it using it for vaginally or rectal. Peroxide number is 600 peroxide number, vaginally and rectally. Rectally for hemorrhoids, fissure, and other proctitis, paraproctitis, and prostatitis, because the substance can be reach the area of prostate. For vaginally, we can use it for treating uteric ulcer, all kinds of touch infection, and other. So, this is how you can treat this real condition. Okay. We have another, it's this boson Ozone Vita Denta for gum and okay. So next, да. Yes, close. It is last, but very interesting. I developed a new, absolutely new method of ozone therapy. Therapy with named subtotal ozone treatment of skin. We have special bag and put patients to this bag for this one. And treated it 1 hour, 20 procedure can give to you, to patients, of course, warranty result of anti-hypertension effect, half year duration. For example, from 190 ml of mercury column to 120. Okay, and of course it is have time remission, and this remission depends on initial condition of patients. It may be from 4 months to 6 months, 9 months. This is new method. No needed any injections. No needed any another procedure. Which, so some patients don't have very needed caliber for treatment. Yes, you can use this variant.
Do you have this bag here?
Huh?
Do you have the bag here?
Yes.
The sample?
Yes. Yes, I have this one.
What is the bag?
Is it for leaking?
It will, you tie it here, right? It should not be inhaled. There should not be a leak.
No. You
ये हम
mitigate.
पहले blue bag देते थे ना?
You can mitigate to keep on neck.
Yes.
And
अच्छा ये tie it. And you add ozone to it.
yes, this film is ozone resistant. This is pretty clear.
Yeah, we had the similar, but I just wanted to know the quality. Where will that ozone flow out?
Within the line.
You have come out of the bag. बंद है ना? नीचे से बंद है ना?
Actually, here the volume given is low. Volume of ozone given inside is low. So it won't get.
But
हम लोग bagging principle पे करते हैं ना? We tie it here, like this, and we have a towel here. I don't know whether people you also remember. So here you're tying it here.
subtotal application.
Out of, like, head is out.
And we have patent on this method, and this method warranty decrease in systolic blood pressure to 25% during 20 procedure. 20%, yes. Well, this is all. I have no time. I have many another
No,
information.
so you on his stall, he
Yeah.
has a stall on the 3rd floor of our concert. The conference is on the 2nd floor, and all the exhibitors are on the 3rd floor. You want to spend time with them? I'm open. Okay? But only thing is now 7 o'clock, Distillery has some party here. So we have 2 stalls. That is
Okay, last.
This lecture you're giving tomorrow?
Yes, I do. This last idea, it is our with Dr. C.B. monography about medical gases. You can see this here
QR code.
QR code, and buy this book for knowledge. Okay.
Look for knowledge.
Thank you.
Dr. Sudhir, can you put this QR code on my WhatsApp? I will share that. Yeah?